Hello, YouTube. We are just finishing setting up for our live support group meeting. So if you can hold tight, I would appreciate that. One sec. One sec. All righty. Let's see here. We're going here. Donna, is that you? Hold on. All right. Oh. Right. Doing the face. Okay, hold on. Let's get that right. There we go. Got 2 pairs of glasses on. Hello, YouTube. This is Jill. Getting ready to start our support group meeting. I'm just setting up Facebook here. Give me one sec. It's my first chance to see what I look like on my screen also. Okay, Facebook, my friends. Let's see here. Lots of little things that I always have to do to set up the stream. All right, there's that. Okay. And we're going to do live video. And we're going to do go live. My voice is kind of funky. I was talking on the phone with my brother last night. And my voice started to go out. So we'll see how my voice does. Yeah. All right. Live, IC, BPS, pelvic pain, COVID, Hunners, COVID cystitis support. All right. Okay, that's good. Hi, Diane. Hi, hun. I clicked go live a little soon on YouTube, so just let me finish setting up Facebook here, and then we will be good to go. All right, streaming software, stream key. So many settings. All right, I go to our streaming software. We put that in there. Okay. And I got to set up my microphone. Hopefully, Diane, hopefully the sound is good on YouTube. I hope so. Okay. Oh, that's weird. Oh. Well, let's try this again. There we go. Good. I'm glad. All right. Start streaming. The hair okay? Is the hair okay? Yeah, my voice is all funky. Jeez. Jeez Louise. All right. We are now streaming onto Facebook. It is. Nope. Hold on. Okay. The hair is good. It's always challenging. I've got a lot of hair. When I wash it in the morning, it's always funky. Okay, we got that. I got that. I got that. I got that. We are set. Yes. Me to get a drink of water? Put this right here. I got something important to talk about. A couple of important things. All right, we are going live on Facebook. Thank you. Thank you guys on YouTube. Really appreciate your patience. Okay, we are live. Mm. What? What? What the heck is that all about? Weird. All right. Hello, my friends. Jill Osborne from the Interstitial Cystitis Network. It is, God, that's a weird message on Facebook. It is Sunday, September 24th, time for another live IC support group meeting. Um, I am live streaming these meetings right now. We are on YouTube. We are on Facebook. Facebook, there's a really weird message. I need you guys on Facebook. Could somebody please type in here and let me know that you can type? You know, the problem with these platforms is that they make a lot of changes and they never tell us. And you can tell my voice is a little funky right now. So testing on Facebook. Number 1, can you hear me? Can you hear me? And number 2, and yes, you can type. Excellent. Yeah, it's getting a real weird message there. All right. Let's try this again. My name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. We are the national IC support group. I am the national IC support group leader here for you, the longest serving IC support group leader, I think now in the world, certainly in the United States, very close to being in the world, if not in the world now. My purpose in doing these meetings is to educate, inform, hopefully get you to look at your symptoms in a new way. Maybe if you're not responding to therapy, considering some new therapies that might be more effective, et cetera, et cetera. You can tell my voice is a little funky. I don't know why. I don't know why my voice is doing this. I feel fine. But anyway, but I did talk a lot yesterday, so it might be a little laryngitis. We'll say. So normally when I do these meetings, I do a little 30-minute intro and then take your questions. Um, I have a lot to talk about this morning. And the very first thing I want to do is just commend the Interstitial Cystitis Association. They did a brilliant live IC event yesterday featuring Robert Moldwin and staff at Northwell, Rob Moldwin is one of the top national doctors for IC. He has a fabulous team of physicians that he works with as he runs their pelvic pain center. And they did a 3-hour event, which was just spot on perfect. It was exactly what we want to see during IC Awareness Month, and the ICA did a kick-ass good job. Thank you, ICA, for bringing the best to the internet. We cannot wait for the live video because I want everybody to know what you've done. I'm very, very impressed. Um, the other thing that the ICA did is they got a proclamation for IC Awareness Month that one of their people did. Years ago, one of the ways we raised awareness for IC is we would go to our state, we would go to our senator, go to our community, and ask them to issue a proclamation for IC Awareness Month. I have many of them. Here's one, for example. So here's an example of a proclamation. And this is one of the ways that we get government officials to listen to our needs and to educate and to inform. Now, these kind of slowed down, especially through COVID. And I'm very, very happy to see that the ICA is encouraging it. It's fantastic. Because listen, the more the merrier. Lori, I don't know yet. The video has been not up yet. It was not my event. It was the ICA's event. And I'm just thrilled. Loretta says some people can't find you on Facebook. They try to access you on the private network site. Can you help? Loretta, if they're trying to come to the live event right now, they can just go to our YouTube channel. And our YouTube channel, all they need to do is just search for Interstitial Cystitis Network, and they should find it, or IC Network. If you go to the IC Network website, and you go down, you go up to the pull down menus at the top of the page. There's under support a link to live events, and they can go there to find the link to YouTube and to Facebook, et cetera, et cetera. Okay, so obviously my voice is going to be a problem today. So I don't want to step on anybody's toes. I'm telling you all, the credit goes to the ICA. They did a fabulous job. Fabulous job. I didn't get to watch the whole thing. I wish I could have, but I had other fish to fry yesterday, literally. But I want to share a couple of slides that Dr. Moldwin talked about towards the end of the event, because the theme is phenotyping. It's very important that we all understand that we are not the same. Not all of us has a bladder disease. Not everybody has a bladder disease. For some of us, it could be an infection of the bladder wall, like a viral infection. For others, it's pelvic floor. And in fact, as he said yesterday, 80% of IC patients have tight dysfunctional pelvic floor muscles. So I just want to share a couple of things that I thought were very, very important. Let's look at this slide, for example. You know, it's very important that you understand that the symptoms of frequency, urgency, pressure, and pain do not necessarily come from the bladder, and they do not always necessarily represent the same thing. And so in this slide, we have the symptoms in the middle: urge incontinence, urgency, frequency, pain, obstructed voiding. Okay, so these are 5 core symptoms associated with bladder diseases, right? So overactive bladder has the top 3: incontinence, urgency, frequency. The typical IC patient is not incontinent. Okay, overactive bladder. If you're running to the restroom because you're afraid you're going to leak, that is a sign of overactive bladder, essentially a nerve issue going on. Now for IC, the symptoms are frequency, pain. And you can see there's a dotted line towards urgency, a little bit of urgency, but the dominant symptoms of IC are frequency and pain, especially pain on bladder fill. Okay, now let's look at this one: high tone pelvic floor muscles. High tone pelvic floor muscles. What are the symptoms of high tone pelvic floor? Frequency, pain, obstructed voiding. So if you ever work with me on the phone, one of the questions I always ask is, when you go to urinate, can you start your stream right away? Or do you hesitate 5, 10, 15, 20 seconds before you can relax enough to release urine? And most people don't catch the word relax. If you're hesitating, if you are hesitating before you can release urine, that is a sign of tight pelvic floor muscles. And remember, 80% to 85% IC patients have high tone pelvic floor muscles. And what are the other conditions that are associated with high tone pelvic floor muscles? Vestibulodynia, vulvodynia, and, hello men, for the guys watching this, chronic prostatitis, chronic pelvic pain syndrome. You know, men face a very, very difficult challenge in this world, because for men, when they have the symptoms of frequency, urgency, pain, most doctors are going to think, they've got a prostate problem, put them on antibiotics, they don't work. Eventually, they put them on prostate meds or meds to help them urinate, they don't work. And for many men, they're on antibiotics for years and these other medications for years before somebody figures out, it's actually their muscles, that the great majority of men struggling with chronic pelvic pain have high tone pelvic floor muscles. Okay? So this is important. This is a good way for you to understand that This is complex. You truly are an anatomical mystery to be solved. So let me go to the next one. So the next question then is, what are our therapeutic targets? So obviously, pelvic floor physical therapy is targeting the pelvic floor. An antidepressant is helping to calm nerves down. Elmeron, or a bladder installation, is designed to kind of coat the bladder and maybe numb the nerves in the bladder. So you can see that we're trying to accomplish different things depending upon each patient. So what are the things that they could potentially target? Varied pathologies. Number one, bladder wall structural defects. If you have estrogen atrophy, or you have chemocystitis because you drink way too much coffee or soda, you have a bladder wall structural defect. We have to work on that. Okay. Number two, bladder wall inflammation. I was thinking about that this morning because, you know, um, what is the legacy? What is the problem when you have a damaged bladder wall? That urine gets where it's not supposed to go. It gets deep into the main tissue where it is causing inflammation and irritation. So, so concept number one, we want to fix the bladder wall. Concept number two, we want to calm some of that inflammation. Number three, what else do we want to do? We want to focus on systemic inflammation. We want to focus on nerve upregulation. So let's talk about nerve upregulation for a moment. So let's go back. Let's think about a coffee drinker or a diet soda drinker. Remembering that your bladder was developed millions of years ago, the mechanics of the bladder, before humans were exposed to very, very toxic, harsh chemicals like artificial sugar and chemotherapy and stuff like that. So we're essentially putting a poison in the bladder, something that's very corrosive, something that's very irritating. So eventually that irritant is going to defeat the defenses of the bladder wall and start causing direct injury. I mean, if you had a wound on your hand and you poured acid on it every day, what's going to happen to the wound? It's certainly not going to heal. It's probably going to get bigger. That same concept applies to the bladder. You start with a little wound, you continue to drink the diet soda or the coffee or the green tea or use ketamine or something like that. The wound is going to get bigger and bigger and bigger. Now we have inflammation deep into the tissues. So not only are the tissues inflamed, but the nerves are now getting inflamed. And that's a very, very slippery slope because if you keep irritating the nerve, that nerve is going to get upregulated. That means it's going to get easier to turn on. If you keep damaging a nerve over and over and over again, you're starting to injure that nerve. It becomes more sensitive. And that nerve sensitization starts locally at the site of the injury, but then it can spread to the spinal cord. Now, we know that because we have research that shows that if you injure the bladder, the bowel can become irritated. If you injure the bowel, the bladder can become irritated because their nerves merge at the spinal cord. So that local nerve inflammation spreads to the spinal cord. And if it persists, that inflammation then spreads to the brain. And now what we've got is systemic neurosensitization. You've got systemic inflammation. Now, it's fixable potentially if we stop damaging the nerves in the first place and we do things that will calm and soothe those nerves. But if we keep prodding those nerves with caffeine and we keep prodding that side of the injury and poking over and over and over again, you're dealing with potentially a progression of this nerve sensitization. So what is he saying here? Systemic, systemic nerve upregulation, and then the next step, central processing alterations. That's where the brain gets all goes into fight or flight with that upregulation process. We know that is a connection between the many chronic overlapping pain conditions that happen for patients who have multiple pain conditions. You're stuck in fight or flight. You have massive anxiety disorder, massive catastrophizing, ruminating, where you keep thinking the things over and over again. That's not mental illness. That is a central sensitization, the result of a nerve injury. Also, we have to remember that on the nerves between the bowel and the bladder merge at the spinal cord. So if there's something going on with the bowel, it could affect the bladder. If there's something going on with the bladder, it could affect the bowel. And also, last but not least, and probably the most important, is the relationship between the bladder and the muscles, because the muscles will absolutely affect how the bladder is functioning. So we've got 1, 2, 3, 4, 5, 6, 7 different things that could be playing a role in your pain. And we've got 7 different therapeutic targets. So now we know why doing bladder treatments didn't work for so many patients, because bladder therapies, which might coat the bladder, are not going to calm nerves down. They're not going to relax muscles. They're not going to directly calm those nerves down like some other medications or other things would. So we've got some very solid therapeutic targets now that work. And let's see here. Another way of looking at it, so think about our subtypes here. We have 5 core subtypes. At least Chris Payne believes that there's 5 core subtypes: Hunner's lesions, bladder wall driven, pelvic floor driven, widespread pain, central sensitization. And so Robert Moldrin in this conference yesterday has a very nice diagram right here where he's showing that. Here's the IC patient. Some of you have Hunner's lesions. So we're going to treat those Hunner's lesions with Hunner's lesion specific treatments. Some of you have other bladder wall issues like estrogen atrophy. And that's where we're going to do intravesical installation therapies, something like a rescue installation that might help coat the bladder and calm the nerves in the bladder. Some of you have widespread pain. And for widespread pain, we're going to do medications, which you can see over here, and treatment protocols that can calm those nerves down systemically: tricyclics, gabapentin, cognitive behavioral therapies, multidisciplinary approaches, mind body medicine, stuff like that. Everything designed to calm nerves down. And last but not least, for that patient with pelvic floor issues, pelvic floor physical therapy. So this is what we need in the IC world. This is your challenge as a patient, is we want to make sure that we know what we're treating. And I say this because some of you, and you guys bear with me, I started my stream a little early and I actually didn't get to brush my hair that last time. How do I want to say this? I want to say this in the right way. A lot of people call my office and they list off everything they've done. Jill, I've done everything. I've done this, I've done this, I've done this, I've done this, I've done this. What do I do next? And they're not focusing on trying to figure out the underlying anatomy. They are doing the equivalent of chasing their symptoms. That's all they're doing. They're chasing their symptoms. They're not fixing underlying anatomy. And what do our national guidelines say? If you're not responding to therapy, if you're getting worse rather than better, stop what you're doing, take a step back, revisit the diagnosis, and let's make sure we know what we're doing here. I'm thinking of one patient that I worked with who, was just kind of in a frenzy and hopeless. She just felt hopeless. I've done everything, Jill. I've done everything, everything, everything. I'm done. I'm over. Why try any further? Nothing works, right? That was her attitude. And we go through the subtyping. I mean, she's just gobsmacked. It's like, do you realize we don't even think about IC as a bladder disease so much anymore? We think of it as pelvic pain disorder. No. Why? Because we now understand the roles of nerves and muscles in triggering a lot of these symptoms. Oh, I didn't know that. We go through her symptoms very, 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 very slowly and consistently. Do you have pain as your bladder fills with urine? No, I don't. When is your pain the worst? After I'm done urinating. Okay. When you go to the bathroom, can you start your stream right away or do you hesitate? 5, 10, 15, 20 seconds. She goes, I hesitate almost all the time. Sometimes I can pee. Most of the time I have to wait. So what bell is that ringing? Pelvic floor. And I asked her, I said, is sex painful? Yeah, it's always been painful. Do you dread going to the gynecologist for your annual exam? Because it always hurts. Yes, it always hurts. I hate going there. And it's like, honey, do you know what you have? She goes, no. I went, you have pelvic floor dysfunction. Those are not symptoms of your bladder. Those are symptoms from your pelvic floor. And I said, okay, when you have your pain, where is the pain? Is it centered or is it to the left or right of center? She goes, it's on the right. I went, honey, that's not your bladder. Your bladder's not on the right-hand side. That's your muscles. What? That's your muscles. Have you had a pelvic floor assessment? Now realize, diagnosed 20 years ago. She went, no. And I went, well, that's your next step. There's no reason at this point in time to start buying more supplements or more this or more that. We have to figure out what the hell's going on with your muscles here because your muscles are dysfunctional. You cannot pee on command. You have pain after urination. If it were your bladder wall, you'd have pain as your bladder filled with urine. You don't have that. And she was just gobsmacked. I was like, what? This isn't IC. And I'm like, no, that's not your bladder. That's your pelvic floor. Those are all symptoms consistent with your pelvic floor. And for those of us who were diagnosed 10, 15, 20 years ago, you have to remember that doctors weren't doing pelvic floor assessments back then. So many of you, especially if they looked in your bladder and found petechial hemorrhaging or glomerations, your assumption is, yeah, I have a bladder disease. But the petechial and hemorrhaging and the glomerations are thrown out. They don't mean anything. They don't mean anything anymore. So again, rather than giving up, rather than adding more and more and more and more and more to your protocol, follow the guidelines, stop what you're doing, take a step back, revisit the diagnosis, and try to figure out underlying cause. Here, give me one quick sec. Hold on. All right. All righty. So, what I loved about the event yesterday is that this is exactly what Dr. Mulder talked about. Subtyping, phenotyping. That is our future. We want you to get better, and you're not gonna get better chasing your symptoms. You're gonna get better when we take a step back and try to study your body a little bit more, okay? It's just like that. I don't wanna say easy, but let's not put the cart before the horse, right? We have to figure out anatomy first and what we're trying to deal with. Um, there was another patient that I was working with. One of the other things that I consistently see in patients who call, is a history of previous surgeries. So another patient that I was working with, her symptoms began almost immediately after she had her first baby. And one of the most important questions I think every doctor needs to ask every patient is there any event that you associate with the onset of your symptoms? Because if it happened after having a baby, if it happened after a fall, if it happened while you were traveling, those are all very, very important clues that will help us figure out the underlying anatomy. Um, Hi, Donna. Hi, Deborah. So, you guys, when I'm looking here, I'm looking at Facebook. When I'm looking here, I'm looking at YouTube. Hi, Allison. Eddie says, I have pelvic floor, but I'm also food sensitive. I have triggers that get me every time. Okay, but Eddie, there's a very, very important reason, an easy reason why that's happening. This is the viscerosomatic or the somatovisceral reflex. So, how do the muscles influence how the bladder behaves? If your muscles are tight, what are they doing? They're restricting blood supply. If your bladder is supposed to get 24, 28 units of blood a day and it's only getting 10 because your muscles are so tight, are you going to have a healthy bladder wall? And the answer, of course, is no, because your bladder is not getting the oxygen it needs, the nutrition it needs to heal. And so a state of ischemia occurs. That's where tissue is not getting good blood supply, it's not getting nutrition. So, will somebody with extended pelvic floor dysfunction be food sensitive? Absolutely. Absolutely. Because you're in ischemia and that's affecting the health and structural integrity of your bladder wall. So that's why you're food sensitive. And ultimately it's a chicken versus the egg, which comes first, the chicken or the egg. And for us, it's which comes first, the bladder or the pelvic floor. For some of you, yes, it begins with chemotherapy or just having an absolutely terrible diet where the bladder wall gets injured, the bladder wall screaming in pain, and the muscles get tight to protect you from the pain. And our therapeutic priority for that patient is to calm and soothe the bladder first, and we hope that the muscles will relax as the bladder calms down. But that's the minority. The majority of you and me, it begins with a muscle trauma. I broke my tailbone in 7th grade. My symptoms began in 7th grade. Of course, we didn't know that back then. I had frequency urgency. I couldn't sit through class. School called my mom. My mom called the doctor. They assumed I had infection. I remember I had to swallow 16 sulfas in one sitting. They thought I had a massive infection, which I didn't. I'm sure I did not. And my urethra was like this. I was diagnosed with a urethral stricture. So they used a metal probe, bam, to open it up. Not fun. Had about 100 of those. Had them every week for a year. And then for the following years, I had them every now and then. Rather than asking, gee, why is your urethra narrow? Oh, yeah, because your muscles are tight. Your levator ani is tight. And this is why, again, the event yesterday was so important. The single most important test you have at your very, very first appointment with the urologist is a pelvic floor exam. Takes a minute. Glove, finger, up your vagina, up your rectum, touching muscle. Tight muscle feels like beef jerky, and it's painful to touch. Healthy muscle is like a raw chicken breast. It's got structure, but it's soft and pliant. And if you have tight muscles, you are to be immediately referred to pelvic floor physical therapy because we have got to get you out of that state of ischemia. Shira says, if it started after a UTI, always microscopic blood and urine, is it likely to be bladder wall? Not necessarily. If I don't want to do installations, what else can help me? Well, Shira, we have to subtype you. We have to figure out what your subtype is to figure out what the right treatments are for you. If you want to do that, we can do that right now. I'm happy to do that. So you tell me. Now I want to. Oh, Lisa says, can you talk about vaginal atrophy? Absolutely. Think about your bladder for a moment. It's the only organ in the human body designed to hold toxic waste because urine is body waste. Urine contains ammonia and urea and all sorts of irritants, also all the byproducts from smoking, chemicals in the environment, all that ends up in your bladder where you pee it out. So, how can the bladder hold ammonia for hours and hours at a time and not get damaged? It's really an evolutionary marvel. Well, it turns out your bladder is wet on the inside. Your bladder is like your mouth. It's a hollow organ with a really thick coating of mucus. We call it the mighty mucus. And the purpose of the mucus is to serve as a barrier. It protects the nerves. It protects the more vulnerable skin cells. Makes it harder for bacteria to get to those skin cells. Unfortunately, that nice thick mucus is estrogen dependent. So when you're young and you have a lot of estrogen, you have a lot of mucus. But if you've had a total hysterectomy, if you're on Lupron, if you're on very strong birth control, or you just happen to be getting older, you don't have the estrogen anymore, which means that your bladder, the cells of your bladder wall cannot produce the mucus anymore. So your mucosal layer gets thinner and thinner and thinner. This is why every older woman talks about dryness. When your mouth gets dry, it hurts. What do? You suck on water or you suck on ice. When your bladder gets dry, when your urethra gets dry, when your vulva gets dry, when your vagina gets dry, it hurts. That is estrogen atrophy or vaginal atrophy. The correct name for that now is genitourinary syndrome of menopause. Danielle says, my son was born with hypospadidosis. Could he have gotten that through me? Honey, let me look it up. I'm not familiar with that. Hold on. Hypospadidosis. It's a birth defect where the opening of the urethra is not located at the tip of the penis. Isn't that interesting? No, honey. That's not related to IC at all, hon. That is a structural abnormality that occurs in the first 8 to 14 weeks of pregnancy. It just means that cells didn't grow correctly. So there's no relationship between that and your IC. I can't, it makes no sense. So I would not be worrying about that. Lisa says, what can you do if you can't have the estrogen? Well, it's very tricky. So if you can't use the estrogen, then let me get something off on my shelf here. And you guys, last week of IC Awareness Month, have you done anything to spread the word? For goodness sake, share our daily fact. Do something. Let people know about this. Okay, so let's grab that. And let me grab this and this and this. Okay, so for those women who cannot use estrogen for one reason or another, then there are two things that you have to think about. Number one, the coating on the outside. A classic symptom of somebody with estrogen atrophy is urine burn, where your urine feels very, very hot as you're urinating. And you're going, what the hell? What is this? This must be infection. It's not infection. If your urine feels hot, Really what that means is that the skin that the urine is crossing is very, very dry. That's estrogen atrophy. It just is what it is. So, um, the skin is meant to be moist. So the way you protect the skin on the outside is with coconut oil or using something like this. This is called V Magic. V Magic. This is very, very popular in our store by patients. So V Magic is a organic, extra virgin olive oil, avocado oil, honey, sea buckthorn oil. Very, very popular. Here, Donna says she loves V Magic. You can see, it's hard to show you what it looks like on the inside. This is about as close to human mucus as you're going to get from a feel standpoint. It's very light. It's not particularly sticky, and it's perfect for that skin. So if you're struggling with urine burn, you can try V Magic. That's right in the IC Network shop. Um, please buy from the IC Network. Don't buy from Amazon because it's usually cheaper in our store. But number one, it helps support this live stream because we have to make a living too. Okay, for your bladder, you're not since you cannot use an estrogen, you're going to end up doing something that will give you a little bit of extra protection in the bladder, and that's going to be a chondroitin based supplement. And so that's going to be bladder rest, bladder builder, cystomend, and cystoprotect. And so this is where Elmeron shined as a therapy because Elmeron is basically a chemical band-aid, but Elmeron is now associated with some pretty significant adverse events such as retinal damage, blindness, and now inflammatory bowel disease. So what the AUA actually encourages is they want you to try the supplements before you try medications that are associated with greater risk. And so you can try some of these supplements. They're all on the IC Network website. Just so you know, I didn't talk about Cysto Renew. That's also kind of an old formula, although some patients love it. There's a manufacturer's outage. We will not have it until January. It's gone. And also with Cystoprotect, understand that the company has just made the decision to reduce the number of pills per bottle from 120 to 90. That's a company decision. I have nothing to do with that. Don't blame me. And so what does that mean? It means you're going to have to buy more bottles to get through the year at the same price. So that's a whole nother story. I'm waiting for an official statement from the company, but I want you to hear that from me because the next shipment that we get from them, which is on the way to us, will be these reduced bottles. And I have no control over that. Donna says she loves Cystomend. Gary says, does D-mannose 500 and quercetin help IC pain? D-mannose will not help IC pain. D-mannose acts to help eliminate E. coli in your urine. And that's operating on the assumption that some people think that every IC patient has an infection. Well, we don't. So the D-mannose is pointless unless you have a history of E. coli infections. If you have E. coli, power to you. And we actually have something better than just plain D-mannose. We have Prevent, which many patients who struggle with recurring UTIs are now using. Quercetin has a mast cell reduction effect. It's an antihistamine. So quercetin can help. You know how when you get a mosquito bite, it gets red and swollen? Well, that's the body's reaction to the venom of the mosquito. That venom actually triggers the mast cells to release histamine. The histamine causes things to turn red, swell, and start to hurt. We used to describe IC as 100 mosquito bites at once in the bladder. So there's absolutely a place for using an antihistamine in the typical bladder wall patient, and quercetin can help that to a certain degree. Um, but so can hydroxyzine, Vistaril, or Atarax, which are traditional medications. Okay, so hold on a sec here. Shira, it's called Cystoprotec. Cystoprotec was the original chondroitin supplement. It's a first generation supplement, and we now have newer supplements that have adapted that formula to make it a bit more effective. And so the bladder builder and the bladder rest and cystomans are the next generation. They're the third generation. So first generation supplements are Cystoprotec and Aloe. Second generation supplement is Cysto Renew. The third generation supplements are going to be the bladder builders, the bladder rest. Those are the newer ones. Diane says, I have widespread pain. I have IC and IBS. Would gabapentin help at night? This is when I'm most bothered with frequency urgency. It could, because gabapentin helps to calm nerves down. What our research is showing us, Diane, is that, and I'm in this group too, hon. I'm in the chronic overlapping pain condition group, but I don't have any pain now. Why? And I had very, very severe IBS in my 20s. I had very severe vulvodynia. I had migraines in my 20s. I had a lot of the chronic overlapping conditions in my 20s. I don't have any of them now other than TMJ. That's getting slowly a little bit better. Why? Well, what our research is showing us, and because I wanted to know, like my friends were all out living their lives, getting married and having babies. And when I was in my 20s, I was laying on the bathroom floor in the fetal position every morning. The, the my bowel cramping was so severe. And when you're the patient and you're so confused, just like every year it's something new. And I thought that I was being punished. Quite honestly, I thought that God was punishing me. I thought that I was a bad person. Really, I did. None of it made sense. And I wasn't a bad person. Now was and how did I get through that moment? Well, the first came with some early research about genetics that showed that some patients have a filial connection. Um, I'm a redhead. What do redheads have? Very, very sensitive nerves. And if you look at everybody in my family going back generations, especially my mother's side, very, very sensitive skin. My grandmother had IC. My mother had IC. My sister had IC, but IC doesn't mean anything. The correct diagnosis is pelvic pain neurosensitization. They all had that. And that was a very pivotal moment for me, because it was at that moment I went, oh, wait a second. It's really not my fault. I've inherited some stuff. I've inherited more sensitive nerves. And then the pelvic floor data came out. So not only do I have very sensitive nerves, but I suffered a major, major injury the year that my symptoms began, when I was 14. And what the research shows is that for 80% of the children who develop multiple pain conditions, for 80%, there is a major physical trauma. And I've worked with a ton of you. And yeah, you'd be amazed at the number of patients who have fallen off of horses, they've been hit by cars. The injuries are rampant. For anybody in their 20s or teens or kids who develop these symptoms, we're always going to consider the concept of injury first. It's amazing how often it happens. And that injury begins this whole process of muscles getting tight, nerves becoming sensitive, the bladder eventually getting involved, and Then the nervous system gets involved, and then these other related conditions start to develop. For the other 20%, there's a history of abuse or bullying. And I happen to have the trifecta of injury and bullying because I grew up in a neighborhood with a kid who later became a rapist and murderer. And the year I went away to college, he raped and murdered my neighbor. And I did not leave my house without fear for probably 15 years. So think about what that did to my brain. I was in a state of fight or flight every single day. My safe place was going away, going to visit my aunt in San Diego. I felt safe there. I didn't feel safe here. So, what the research shows is for patients who have multiple pain conditions, what we see is a brain in a constant state of fight or flight. This is a central nervous system injury. This is not mental illness. We call this a central nervous system maladaptation. This is what happens after major injuries, and this is what happens after bullying. The brain changes the way it behaves. Fight or flight is only supposed to be on for a brief period of time. And then the parasympathetic nervous system retakes control and lowers your heart rate, relaxes your muscles, etc. But for those patients who are struggling with widespread pain, you know you have anxiety disorder. You are the no person. Hey, Jill, you want to go? No. You want to? No. Go to the movie? No. You want to go out to eat? No, I have a flare. You want to? No. I've asked many doctors. That was my life in my 20s, 30s, and 40s. Why do I do that? I want to go out. I want to go socialize. I don't want to stay at home. Why does my brain go, no? And it's because my brain is guarding, because my brain is trying to protect me, because my brain was stuck in fight or flight. Emphasis on was. Because the thing which really between physical therapy was massive for me, working on the muscles, huge, but also working on the nerves. And I was very blessed that when I was in my 30s, I signed up for a class that taught me how to calm my nerves down and taught me how to get me out of fight or flight. And once I got myself out of fight or flight, wow, everything, the volume changed. You have to remember anxiety and fight or flight intensifies your pain because your lower brain, your sympathetic nervous system is trying to save your life. It is deliberately going to intensify all of your pain because it's trying to get you to take action. So pain accompanied by anxiety will always be intensified by the brain. Pain accompanied by laughter will always be minimized by the brain because you're laughing, therefore your life is not at stake. So a lot of patients are very offended when we talk about something like mind body medicine. They're like, don't tell me it's all in my head. It's not all in your head. But what you do have are injured nerves. And what we do have to do is we have to calm those nerves down. Nobody's saying that this is mental illness. No one. This is injury. You have an upregulated nervous system. We have got to get your brain out of upregulation. We have got to calm everything down. And we do that with very simple mind body medicine techniques. All right. So, yeah, Shira, sorry about that, Shira. I just kind of had to finish that here. Hold on one sec. Okay, so Shira, how old are you? And how old were you when your symptoms started? That's my first question for you as we try to phenotype Shira. How old are you? And how old were you when your symptoms started? Okay, she's 52 now. Okay, how old were you when your symptoms started? Was it last year? Was it 10 years ago? 20 years ago? You were 48. So so 4 years ago. Is there any event that you associate with the onset of your symptoms? Is there a hunch? Like you always thought it was because what? And it's okay if it's no. You can say, I don't know. You had a UTI. Okay. Was that UTI confirmed with a urine culture? Or did they just tell you that they thought you had a UTI? You have to remember the bladder only knows one language: frequency, urgency, pressure, pain. Everything feels like a UTI. A bullet wound would feel like a UTI. A stab wound would feel like a UTI. Tight pelvic floor muscles will feel like a UTI. So many patients keep thinking they're having UTIs over and over and over when they're not, that it can be something else. Okay, do you remember the type of infection it was? Did they identify the bacteria? Was it E. coli, staph, strep? Okay, did they tell you what it was? E. coli, staph, strep, enterococcus, micrococcus, fungus, candida. It's Klebsiella. Okay, okay. So let's think about our subtypes for a moment, and let's go through the 5-point subtyping system. Um, I see subtype 1 Hunner's lesions. These are patients who have big bloody wounds in their bladder wall. So has anybody looked in your bladder? Have you had a cystoscopy or a hydrodistension with cystoscopy? And if you have, what did they see in your bladder? Did you have a normal bladder, or did they see wounds or swollen blood vessels? And if nobody's looked, say that too. Nobody's looked in your bladder. So that's going to be, here's my philosophy. I have two very, very clear philosophies about my own medical care. Number one, if I'm in pain, I want somebody to look at it. I am not interested in guessing anymore. I suffered for decades with pain as doctors guessed. And so I am now very, very motivated to, whenever I'm having any weird pain, especially longer than a couple of weeks, I go to the doctor. I want you to look at it and tell me what's hurting. So that is, and number two, not to be afraid of the cystoscopy, because most of us have a perfectly normal bladder. But this is an important way to make sure that there's not something else going on. For example, Shira, there's something called a bladder stone. A bladder stone is kind of like a kidney stone, but it's so big it cannot pass through the urethra, that you have this sharp edged stone floating around in your bladder that basically is cutting the bladder wall wherever it floats. And so having a diagnostic cystoscopy, I call it a looky-loo. It's done in the doctor's office. They numb your urethra, stick a cystoscope up, put a little fluid in there, look around, pull it out, you're done. And, you're done in 15 minutes at most. And it just gives the doctor an opportunity to look at your bladder wall just to see if there's ever anything funky going on. And I tell this story because we had a patient who was terrified of having a cystoscopy, and she didn't have one for years and years and years. And her IC was very consistent. Her pain was persistent. She flared all the time. And finally, just out of sheer exhaustion, she said, "Okay, you can look." She had a giant bladder stone floating in her bladder. It had been in there for years. And once they broke up the stone and got it out, what do you think happened? Her symptoms went away completely. So that's an important diagnostic test to have. It's been 4 years, girl, and you've been struggling and they haven't figured it out. Time to let somebody look. I would at least talk to your doctor about that. The only concern with this, there are two concerns with the cystoscopy. Number one, it stretches your urethra. So the couple of times you urinate, not fun. Your urethra is going to be very, very sensitive. And number two, anytime they put an instrument into your bladder or through your urethra, you do run the risk of getting an infection from that. And so they might give you an antibiotic for a couple of days just to prevent that. But there's a time and a place for cystoscopy, and after 4 years of suffering, you're kind of at that place, in my opinion, but talk to your doctor about that. That said, if you had to rate your pain on a scale of 1 to 10, what's your pain? What is your pain level? And you guys, if I miss anybody's question, just ask it again. Don't take it personally. It just happens. Caroline says, I guess mine is a nerve issue since the amitriptyline helped. Yeah, amitriptyline calms nerves down. So that's good. That's very, very good. And I'm glad you can tolerate the amitriptyline. I couldn't. Okay, so we're back to Shira. If you had to rate your pain on a scale of 1 to 10, what's your pain level at? Like, are you always in severe pain? If you're always in severe pain, then we really have to think, we have to consider that you might have a Hunner's lesion in your bladder. But if you're not struggling with intense pain, then I think we can walk to our next subtype. She says it was a 10. Now with the supplements, it's around a 5. Good. Okay. Interesting. What supplements are you taking, Shira? Now our second subtype is bladder wall driven. So where there's definitely something funky going on in the bladder wall. So the first thing we think about in the bladder wall driven group is chemical injury. Are you drinking diet soda, coffee, green tea, cranberry juice, orange juice, stuff like that that will irritate the bladder wall? If you are exposed to a chemical toxin, good. She's taking bladder rest and Peora. Excellent. Excellent choice. Um, we want to try to identify any chemical irritants so we can get rid of those. But the second thing we're going to look for is estrogen atrophy. Because as you get older, your bladder wall changes and starts to get dry and becomes more sensitive. And Carolyn, and Shira, your symptoms started at 48 when you're in perimenopause. So we cannot rule out that you are in estrogen atrophy. Um, uh, Especially as you get older, you're just going to be getting drier and drier. Shira, did you ever have a hysterectomy or anything like that? Have you been on medicine to restrict your estrogen in any way? You take Activell for estrogen. Activell. What is Activell? Let me look at it. Hold on. Activella? Activia? Activelia? Oh, it's an estradiol. Okay. Oh, it's a combination of estradiol and norethindrone to treat the symptoms of low estrogen levels such as hot flashes, night sweats, and vaginal dryness. So, okay, so the problem with taking an oral medication is that not enough of that is going to arrive where you need it the most. Because when you swallow it by mouth, it is absorbed into your bloodstream, it is sent throughout your entire body. And really only a small fraction of it is going to make it to your bladder or to your vulva and your urethra. And so it would be perfectly reasonable to ask your gynecologist to look at your skin down there. We need to understand the health of your skin down there, because if you're showing signs of dryness, as you probably are, then using a topical estrogen cream is the best way to saturate those tissues with estrogen. A pill will not do that. And so I would, when you go to the doctor to have them, when you're going to talk about the cystoscopy and stuff like that, you want them to look at your skin to see, the health of it. Because if it's starting to dry, then what you're doing is not enough. Shira says, when I took Vagifem, it didn't help my pain. Okay. The fact that your pain is reducing right now is telling us that your estrogen is probably playing a role in your symptoms right now. Now, the third thing that we want to consider in your subtyping is something that Dr. Curtis Nickel talked about in his proposal for 9 subtypes. He believes that some patients whose symptoms start after having a bladder infection, that they're basically struggling with sensitivity to the nerves because of the bladder infection. And he believes that because it's fairly common, that that infection causes some of that local nerve sensitivity, which can drive some of these symptoms. I don't know how I feel about that. No other doctor in the IC world is even talking about that as a possible phenotype, but he mentioned that, and you can read that on our website if you want. Let's go to our third subtype. So we have number one, we don't know if you have Hunner's lesions. You are an estrogen atrophy because they've given you estrogen. You might have some extra nerve sensitivity in your bladder wall from the infection. Now, our next subtype is going to be pelvic floor driven. These are the patients whose symptoms began after some sort of pelvic floor trauma. So, Shira, let me ask you this. When you go to urinate, can you start your stream right away, or are you hesitating 5, 10, 15, 20 seconds before you can relax enough to release your urine? So, can you pee on command, or do you hesitate? Lisa says, how do you use vaginal estrogen cream correctly? You put it in your vagina, but you can also put it on your vulva and your urethra. There's no right way or wrong way. It's about just using it consistently. Latasha said, would intrarosa help with dryness? Hold on. Hold on, and it's always hard when I'm on 2 computers. I always have to refresh my memory. My memory's not as good as it used to be. Um, it's a prescription med used in women after menopause to treat moderate to severe pain during sexual intercourse. The only vaginal non-estrogen treatment for moderate to severe painful sex due to menopause. Um, it's a variant of estrogen. It's a variant of estrogen. Well, I mean, anything that will plump up that skin and help that skin produce mucus makes sense. So, possibly. Hi, Crystal. Okay, so Shira says she can usually urinate on command. Usually you don't hesitate, but where you have moments where you do hesitate. Okay, when is your pain the worst? Before you urinate or after you're done urinating? When is your pain the worst? Before you urinate, when your bladder's very, very full, or after you're done urinating? So, you guys, for those of you joining, we are subtyping Shira right now. Okay, so she has pain both before urination and after urination. Shira, when you're urinating, are you straining to empty your bladder? Are you pushing it all? And Crystal says, I'm newly diagnosed and I don't know what to do. I always feel like when my bladder is full, my kidneys start to hurt. Can it mean urine is traveling backwards up my ureters into my kidneys? Please help. Crystal, that's called ureteral reflux. That's actually pretty rare. That's pretty rare. Okay, Shira says, yes. Okay, what question did I ask you? Okay, hold on. So before, after urination, you have to push at the end. Thank you. Okay. So that tells us that your muscles are messed up. If you have to strain and you are straining, your pelvic floor is also messed up. Shira, do you ever have any sciatica? Do you ever have any pain that shoots down your leg? I have to tell you, I had a major sciatica yesterday and the day before. Major, both legs. My pelvic floor is locked down tight last night and this morning. And I had to do my internal massage, and then I got down on my hands and knees and I did all my exercises. And most of my pelvic floor tension was in my glute, which was fascinating. It was not internal. I mean, I had internal tightness on my right side, and it was my right glute that was so tight. It was very tender to touch. That's explaining all the pain that's shooting down my leg. Okay. So, Shira, then we don't know the health of your muscles. You are having some symptoms suggestive of those muscles. So, when you go to the doctor to have them look at your skin, you also need to have them do a vaginal exam and touch your muscles. And if your muscles are tight, if your muscles are tender to touch, if they touch a muscle and trigger your pain, that's very, very exciting. That means that's your hallelujah moment. Now we know what we're dealing with. So, and then our last subtype is widespread pain. Well, no, there's another subtype, pudendal neuralgia. Do you ever have positional symptoms that you have pain when you sit down that gets better when you stand up, or pain when you bend over that gets better when you move your body? Yeah, Crystal, hold tight. I'll get you in a sec, and we'll definitely work through your case too. Okay. Okay. So the vaginal exam was okay, but afterwards you had a flare. So that's pointing to muscles. Then that's very common with tight muscles. Um. So if I were in your shoes, I would ask for a referral to a pelvic floor physical therapist and have them do a formal pelvic floor examination. Because we don't know. You don't know. I don't know. You have some symptoms consistent with tight pelvic floor muscles. The fact that you're straining kind of proves it. You should not be straining to empty your bladder. That is a huge mistake because that's only going to make it worse. Hi, Donna. Nice to see you too. Yeah, my voice is all funky, but other than that, I'm good. So, and then our last subtype, widespread pain. These are patients who have IC, IBS, vulvodynia, et cetera, et cetera. So, Shira, do you have any other pain conditions? Does yoga help releasing pain? Yoga that relaxes muscles can reduce muscle pain. Yoga that tightens muscles can intensify pain. Lisa says, can you share the exercises or stretches you do when your pelvic floor is tight? I can. And in fact, if you go over to the IC Network website and you go into our free downloads area, we have a 2-page graphic of pelvic floor relaxation exercises. And you know what I can do is I can, hold on a sec. Let me see. I got you. I got you. So you can find the free downloads area at the very bottom of our IC Information Center pull down link. Let me just print these out so you can see them. So hold on a sec. Okay. Shira says you do have fibromyalgia until the UTI didn't have the bladder pain. But the fact that you have the fibromyalgia tells me that you've got sensitive nerves. Do you have very, very sensitive skin, or do you have a wicked sense of smell? Can you smell things that other people can't smell? And do smells drive you crazy? Okay. So hold on a sec. It's printing. Oh, it's doing it two-sided. Okay. And do you have a wicked sense of smell, Shira? Can you smell things that other people can't smell? And do smells drive you crazy like they do me? I bet you do. Okay, so for IC Network members, if you go onto your member page in your download area, you can download this IC Pelvic Floor Relaxation Series. So what did I do this morning? I did this, I did this, I did this. I did not do that. I should have done that. I did this. Did I do that? I did downward dog. That's not downward dog. Um, but anyway, these are ones that can help. No, you don't have any smell issues. Interesting. Were you a smoker, Shira? Do you have a history of smoking? And Crystal, hold tight, hon. Hold tight. We're working with Shira, but I'll get to you next. Patients who have a history of smoking have basically burned out their smell receptors, and that's why they don't necessarily have that sensitive sense of smell. So a big part of your care also, given the fact that you've got fibromyalgia, you have sensitive nerves. Shira, do you have anxiety? Do you struggle with anxiety and catastrophic thinking? Okay, you do have anxiety. Okay. So, I mean, you said yes. So I'm assuming that means you have anxiety. Okay. So you and I are sisters because I do too. I have those too. And so, therapeutically, the other thing that you and I have to work on very, very consistently is calming our central nervous system down. That what the research shows is that for patients who have widespread pain, our brain is stuck in a loop of fight or flight, not mental illness. It's a result of injury or trauma. And what we have to do is physically get that brain out of fight or flight. And the way we do that is with good sensory information, good mind body medicine. And if we have time later, I can do a couple of exercises that will work. But we have a lot of people with questions. So to sum it up, Shira, this is what I think. The way I would subtype you is you're a match to me. You have central sensitization, widespread pain. You have some estrogen atrophy, and you have some pelvic floor dysfunction. So what that means is that from a treatment standpoint, we have to work on the muscles with physical therapy. We got to improve the quality and health of the skin, and we got to calm the nerves down. We've got to calm the anxiety down. And again, I can talk about that a little bit later, but we have so many questions. Let me keep going here. Crystal, are you still here, honey? Crystal, if you're still here, can you type yes? Crystal. Linda says, I'm 76 years old, diagnosed at 74. Only symptoms are burning in the urethra, frequency at night. Okay, Crystal. Would Pure help with the burning? The Pure would help, but Linda, at your age, that urethral pain is in all likelihood being driven by very bad estrogen atrophy in your urethra. The urethra is a canary in the coal mine when it comes with estrogen atrophy. It's the first part of the urinary tract to start screaming when estrogen levels drop. It did for me. And so, are you using any topical estrogen? Normally, when that happened to me when I was 52, 20 years younger than you, they had me rub a pea-sized drop of estrogen right into the entrance of my urethra. And within 2 weeks, it all went away. I just didn't understand that the urethra gets dry too and can be very, very painful. Lori, yes, it is. Okay, let's go back to Crystal now. So, Crystal, hold on one sec. Crystal says, I'm newly diagnosed and I don't know what to do. I always feel like when my bladder is full, my kidneys start to hurt. Can it mean that urine is traveling backwards up my kidneys? So, Crystal, it's actually urinary reflex is something that your doctor can check for. But let me ask you this. Is the pain on both sides, both kidneys, or one kidney? Both sides or one side? Okay, Linda says, "You tried it and it made it worse." Linda, here's the deal. At your age, estrogen's gonna burn like hell the first week or 2 because your skin is so freaking dry. You've got to push your way through that burning. The burning gets better and better and better over time as your skin starts to produce mucus. Don't walk away from that estrogen. It's very common that some women, they don't like how it feels and they stop using it, not understanding that anything you put on that skin is going to burn at first. But just like a raisin will plump up with water, if you put a raisin in a glass of water, well, that same thing happens to skin that it's an estrogen atrophy. When you give it estrogen, it plumps up and starts to produce mucus. Okay, Crystal says it's both sides. Crystal, are you having that pain right now? Are you having that pain right now? Where is my book? Here we go. Here we go. I'm going to need this book for Crystal. Okay. No, I'm not. You start getting the symptoms right after a kidney stone. My bladder starts when the pain starts when your bladder is very full. Okay, so Crystal, does it feel better after you empty your bladder? Like when your bladder's empty, you feel much better. So if I were to ask you the question, when is your pain the worst? Before you pee or after you're done peeing? When is your pain the worst? Caroline says, gynecologist wanted to give me Premarin in case my yeast infection is hormonal. I said no because she said it could make me bleed. I've had a yeast infection since April. Carolyn, honey, listen, the quality and health of your skin is very, very important to the functioning of the bladder and the vagina and the urethra and the vulva. If you're in estrogen atrophy, that skin is dry and it's going to be much, much easier to get an infection. Throw in the fact that your pH changes in your vagina after menopause, making it more conducive to infection. It's very, very important that we work on the quality and health of that skin, and that Candida can do that. Premarin is a brand name that a lot of patients don't like because it has some preservatives in it that can cause some extra burning. You could ask for a compounded estrogen cream from a local pharmacy that might not be as irritating. Okay. So I wouldn't just walk away from the estrogen. Um, if you're super, super dry, the estrogen is the best thing you can do for it. The other thing you can do with candida is very it's a what's the right word? It's surging right now around the world. Some very, very drug resistant candidas. Um, it would be reasonable to do a next generation DNA urine test to see if they can isolate which variety of candida is and isolate the correct treatment for it. Also, remember that candida grows to sugar. So, the number one factoid for anybody struggling with chronic candida is to stop eating sweets. Okay, getting back to Crystal, her pain starts when her bladder is full. Is the pain and it feels better when you void? Okay, so that's pointing us to your bladder wall. Definitely pointing us to your bladder wall. Crystal, how old are you, honey? How old are you? And are you still having periods or not? Crystal, you don't burn when you pee. My symptoms are frequency, urgency, bladder pain. I get urethral spasms too. I'm taking Vesicare. Also just started taking Desert Harvest Aloe and D-Mano. Sex is also an issue. Afterwards, I'm in pain. That's a muscle problem, honey. The pain with sex is your pelvic floor. You're 37. Are you still having you still having periods? Are you on birth control? Sometimes if your birth control is too strong, it induces kind of an artificial premature menopause, which starts drying out your skin. Okay, interesting. Carolyn, hold tight, hun. I will get to you when I'm finished with Crystal here. So you're not using any birth control. One of the reasons why I wanted to get that book, I mean, listen, you deserve more than a guess. You need facts. And if you think you have reflux, your doctor can do something called avoiding cystogram to see if any urine is going back up your into your ureters. Not the funnest test in the world. It's not terrible. I had it done. Pain in the low back is often associated with tight psoas muscles. So on either side of your spine, there are two very ropey muscles that descend or that start in your pelvic floor and they go up both sides of your spine a good bit. And I will tell you that I get muscle spasms in my psoas muscles fairly frequently. And when I apply heat to those muscles, they generally relax. And let me just see if I can find a picture for you. You would think that I would have my favorite pictures marked, and I don't, and I need to do that. Okay, 226, 227. Let's see if she has a picture of it. They're the muscles that just kind of provide the core strength and weight bearing part of your back. Nope. Um, you're also okay. So Crystal says she's also in pelvic floor physical therapy. So when you went to pelvic floor physical therapy, what did the physical therapist find after your first appointment when you had that proper pelvic floor examination? Do you have tight pelvic floor muscles? I mean, if you're getting therapy, they're not gonna treat normal muscles. Obviously you had tight pelvic floor muscles, but what specifically did they say to you about the health of your pelvic floor? Linda, the problem with taking baking soda is that it's salt and it can raise your blood pressure. And as somebody who has new blood pressure issues myself, I used to do that when I was younger. I would never do it now. Okay, you have slightly tight muscles, but not bad. So Crystal, you're stuck in the chicken versus the egg dilemma. Which comes first, the bladder or the pelvic floor? You obviously have both. So what history has told us is that for some people, this all begins with a bladder wall trauma, like a chemical injury or a UTI, and your muscles get tight to protect you from that pain. And so if you had a terrible diet, if you went through chemotherapy, if you were exposed to any toxins, you could be in that chemical injury group. But that's the minority. The vast majority of us, it begins actually with a pelvic floor trauma. That you're okay. And you say it started after a kidney stone. So, um, two things. If you have a long history of kidney stones, your muscles just may be locked down into tension. They treated the kidney stone, but they didn't treat the muscles, and you've been stuck with tight muscles for a period of time. Or is there a chance you have a kidney stone floating around in your urine, cutting your bladder that's too big and will not pass through your urethra? So it could be either or. Um, I think it's good that you've got a cystoscopy coming. Why not? Let's get a look in there and see if you do have a bladder stone. See if you do have a kidney stone floating around in there. Crystal says she gives me releases manually with her fingers and sometimes it hurts. Well, that's a good sign. If they work with muscles and muscles are tender to touch, I mean that tells me I call that your hallelujah moment. If they can touch muscles and trigger pain, then it's all about muscles. And you've had multiple stones. So, honey, I'm not sure. Do you have a bladder disease? Probably not. I mean, you're not peeing massive amounts of blood. Um, uh, you're doing everything right. You're doing the proper pelvic floor work, and you're going to get them to look in your bladder. We won't know until they look in your bladder. So if you can hold tight for a couple of weeks until they can do that, that would be a good thing. Keep drinking your water. And I think you said you were doing a couple of supplements. You were doing the aloe. So to reduce pain, we actually have a new aloe that is kind of a next generation aloe called Aloe Path for patients that are in flares. So quite a few patients who are using it who are in flares now. Aloe is soothing to tissue. Aloe is great if you have a sunburn. So if you've got a really wicked bladder wall flare, doing some aloe in there could be very, very soothing as long as you're not intolerant to aloe. Some people get stomach aches from aloe or diarrhea from aloe. If you're one of those people, you can't take aloe. But if you aren't, doing a little bit of aloe for a bladder wall flare makes sense. Um, Aloe Path is kind of the best of both worlds because it combines the aloe with PEA, which calms nerves down. And so we now suggest doing Aloe Path instead of just straight aloe. It's just a new way of trying to calm tissue and nerves down at the same time. You've had a CAT scan that shows no more stones in your kidneys, but we don't know what's going on in your bladder. So the cystoscopy is the right thing to do, Crystal. I like the idea that they're going to look in your bladder. Um, um, and it's just going to be a plain cysto in the doctor's office, no anesthesia, no hydrodistension. Lisa on YouTube is asking about THC and medical marijuana. Actually, CBD, the cannabidiol, a cannabinoid, okay, I'm trying to remember how the active mechanism is said. Anyway, cannabinoids, CBD. Those are the ones that reduce pain. And then, so if you're going to use medical marijuana, I'm all for it. Listen, you have the right to look for anything that will help reduce your discomfort. If you want to give medical marijuana a try, that's great. Um, you need to get a brand that has good testing to make sure it's not contaminated with any pesticides. And I would make sure that it's high in CBD because CBD is the pain fighter. THC is the part that chills you out. CBD is the part that reduces pain. And Donna says she uses a company called New Leaf, small company, organic company, good third party testing. Excellent. Susan says, I've developed a ridiculous amounts of gas with IC and IBS. Good luck. Good. God bless you for all you do. Susan, are you farting or belching? All right, Crystal. So if she's going to put water in your bladder, you need to clarify if she's going to do a hydrodistension. That's what they do is they fill the bladder with water, stretch the bladder, hold it in there for a period of time, drain it out, fill it up again, and then they look at the bladder wall closely. The problem is when you stretch the bladder with water, it hurts like hell. That's why a proper hydrodistension with cystoscopy is done as an outpatient procedure with you under twilight anesthesia or propofol so that you don't feel that pain. But if it's just a plain little cysto where they just put a little tiny bit of water in there, you're good to go. But I would clarify with them if they're doing a hydrodistension or not. I've had 2 cystoscopies, I've had 1 hydrodistension. If my doctor wanted to do a cystoscopy like right now, I would do it. I've already had 2. I'm not afraid of a cystoscopy. I know first couple of times I pee afterwards are not gonna be fun, that my urethra is gonna be very tender, but that looky-loo into the bladder with a quick cystoscope is a valuable way for the doctor to look at that tissue. A hydrodistension with cystoscopy is much more invasive. They're really stretching tissue, they're deliberately stretching tissue, and you don't wanna be awake for that. Shira, no. Shira's saying, "Is ginseng helpful for IT?" No. I would not be doing that. All right, let's go over here on YouTube. So you guys, again, when I'm looking here, I'm looking at Facebook. When I'm looking over here, I'm looking at YouTube. She's mostly farting. So um, how do I want to say this? Um, we know that um, IBS is common in IC patients. So if you're struggling with periods of diarrhea, periods of constipation, or you rotate between constipation, diarrhea, that's very common related to IC, related to nerve sensitivity. Farting, what that tells me is that you're either eating foods that are known gas producers, or your biome has been disrupted by some antibiotics, and we've lost some of the good bacteria, which will help you break down that food. So I'll tell you, and the gas gets in the way of you farting. So Susan, I want to tell you a really funny story. So I had a woman call, um, who, and Caroline, hold that thought. Um, Same thing, massive farting. She was a wreck. She was embarrassed, everything. And I asked her, I said, "Well, are you eating any of the gas producing foods?" She goes, "Well, what are the gas producing foods?" I go, "Broccoli, cauliflower, Brussels sprouts. Those are the most common gas producing foods." And like you couldn't pay me to eat. I'll eat broccoli. I will not eat Brussels sprouts. I have had the worst bowel spasms and cramping from copious amounts of gas from Brussels sprouts. So I said that to her and she goes, "Well, that's my snack. I cook up a big bowl of Brussels sprouts and during the week I just eat them cold out of the refrigerator." I'm just like, "Oh my god. If I was doing that, I would literally be in the hospital." Brussels sprouts are deadly in Jill Osborne's body. And so I just basically went, "What? You're eating Brussels sprouts every day?" She's like, "Yeah, I eat a lot of them." I'm like, honey, those are well known for causing massive amounts of gas." I just said, "Listen, you gotta stop the Brussels sprouts. I mean, stop them for 2 weeks and let's just see what happened." Well, she didn't believe me. And she called me a month later and it was worse than ever. And it's like, "Honey, did you stop your Brussels sprouts?" She goes, "No." And I went, "Ah, Google gas producing foods. You're eating gas producing foods. That's the first thing we would look for." Um, so Susan on YouTube, and guys, for those of you on YouTube, you have a 5-second delay between messages, and that's why you can't type right away. Um, are you eating the gas producing foods? Um, in quantity? That would be the first question to ask. And I think number 2, have you taken antibiotics recently in the last year? Carolyn here on Facebook says, "Is there some type of estrogen that would get rid of yeast?" No, because estrogen is candida is a fungus. You have to use an antifungal medication, and or you have to um, create an environment where the fungus will not grow. So I had a candida superbug years ago. I had a drug-resistant candida glabrata infection for 2 years. Let me tell you, that sucker hurt like hell, and it was in my bladder, and it was on my vulva and in my vagina. It always flared when I ate ice cream. Anything with milk sugar, if you've ever made yeast bread, what do you do with yeast? You have warm water and sugar, and you put your dry yeast in there, and you wait 15 minutes and it starts to bubble. Well, that's what sugar does to a lot of fungus in your body, a lot of candida in your body, is it helps it grow. And so rule number one is you got to cut way back on your carbs and your sugars to not give that fungus food. There's an old book that I used called The Yeast Connection. And that's a book that taught me about the whole food connection. But I could see it. I mean, I could directly see it. And understand now we've got some more, even worse candida superbugs floating around that are absolutely very, very drug resistant. And that's why I would suggest that you have next generation DNA urine testing so that they can identify the specific candida and identify any drug resistance genes and potentially identify the correct antifungal that will kill that fungus. But estrogen will not do all of that. Susan says she's having horrible pains. It's emotional too. You're eating cabbage and beans. Oh, that's the other one. You can't pay me to eat cabbage. I will not eat cabbage. I will not eat coleslaw. I simply will not do it. Um, so I would be doing avoiding diary. I mean, I'm sorry, not avoiding diary. I would be doing a diet diary, writing down what you're eating and what your gas rates are to see if you can try to establish some cause and effect with the foods that you're eating and your gas. That would be number one. And again, Susan, making sure that you're trying to replenish. Remember, all these foods are broken down by good bacteria in your bowel. So we want to make sure you have a good biome going on. And what our research shows us is that IC patients tend to have a less diverse biome. Why? Because we're the ones who've taken a lot of antibiotics, which have killed the good bacteria. So I would want to make sure that you got a good probiotic on board too. But you might need to go talk with a gastroenterologist to see if they can help you figure this out also. But you're not alone, honey. Susan, you're not alone at all. You're not alone. Um, do the diet diary and see if you can establish a cause and effect with that. But if you're having, so when I was at my worst with these bowel spasms, they gave me a medication called Levsin, Levsin, that stopped the bowel spasms. And so you could always ask for that, a medication to help you calm these very, very painful bowel spasms while you're trying to figure it out. Latasha said, my psoas muscles are always tight. Yeah. I mean, how do I know when my muscles are really getting messed up? It's they just start to spasm, involuntary spasm. It's like sitting on a cell phone on vibrate. That's the way my pelvic floor gets. And that's happening right now on my left side. And that was happening last night on my right side too. And that's why I had to buckle down and do my work. Susan said, I have to press hard to pee and get rid of the pain. Well, you shouldn't be straining to empty your bladder. That's going to mess some stuff up. Well, anxiety is not going to cause farting. Um, that's an easy thing for the doctor to blame, but it really speaks to the health of your biome. Are you doing anything with live cultures? Are you like I do coconut milk yogurt a couple of times a week. I don't eat dairy yogurt with milk, but I will do coconut milk yogurt just to get the good biome in there. Even though that's a little high in carbs, I want the good cultures. You're not getting it. He gave you pantoprazole. You're trying this second time. You're not getting any sleep. Susan, what are you eating in the morning for breakfast? Maybe it's something that you think is perfectly fine that's not. I'll tell you what I learned early on in my 20s when I was going through all of that is I can't eat any of the Cheerios, any of those box cereals. There's only one box cereal I can eat now. All those other ones made me I felt nauseous. I felt dizzy, and I got all bloated and gassy with a typical cereal. I also don't eat oatmeal. I had violent bowel spasms eating oatmeal. So that's so Susan, that raises another point. Another thing you could ask for is maybe some food sensitivity testing. So an allergy is when you have an allergic reaction. It causes your throat to swell, break out in a rash, things like that. Allergies are, can be deadly. A food sensitivity is different. What that means is that your body really kind of doesn't know how to process that food, and it kind of is interpreted as a poison. And so I had bend over in screaming pain every single morning for like 4 or 5 years in my 20s. And I remember the first time it happened, I was working for the feds, and I was at 10 a.m., I was on my break, I had a glass of milk, and I had an oatmeal chocolate chip cookie. I was on the floor in the bathroom for hours afterwards. The spasming was so violent. It was the first time that ever happened. I think I was 22. Yeah, like 22 years old. This went on for several years, and I would go to the doctor, and they did sigmoidoscopies and all this sort of stuff to look at my bowel, and nothing worked. I mean, I was just and the doctor said, "Eat oatmeal." Believe me, I ate oatmeal on steroids. I ate oatmeal every single damn meal. I sprinkled oatmeal on salads. You name it, I did it. And over the period of the 3 to 4 years, it just got worse and worse and worse and worse. It was awful. Absolutely awful. And finally, my sister gave me this book, The Best Guide to Allergy. And this book changed my life because it explained the concept of a food sensitivity. And then it offered an elimination diet. And so, first thing it said is stop all your dairy. Well, I'd already stopped my dairy. The second thing it said is stop all of your grains but rice. When I stopped the corn, when I stopped the oatmeal, when I stopped the wheat flour, the next day I didn't have any bowel spasm. Night and day. And then the book said, okay, if you feel better, now you have to reintroduce the grains one at a time. So I introduced the wheat. I was kind of okay. Introduced the corn. Absolutely okay. Introduced the oatmeal. Next morning, bend over and scream or cramping. It turns out that I'm very, very intolerant to oatmeal, and so is my dad. And I can remember as a kid making oatmeal cookies and getting really sick from them. Now, ironically, my family, I am 100% Scandinavian. My family comes from the Arctic Circle, northern Sweden and Norway, and Finland, but mostly Sweden and Norway, like 98% Swedish and Norwegian. So, did they have oatmeal 5,000 years ago, 10,000 years ago? No, they didn't. So, we could successfully argue that one of the reasons why I am so intolerant to oatmeal is because my ancestors were never exposed to it. Therefore, their bodies never developed a method to metabolize it. I have that same reaction to chocolate. I will also get bent over and screamers if I do eat chocolate, even now. Chocolate is like poison in my body, and I can feel it from the moment I swallow it. Wherever that chocolate is, it spasms. My body does not like chocolate, and it will go through my stomach, through my small intestine. When it hits my large intestine, the spasms hit. The spasms go across from the right side to the left side, down the left side. By the time it gets very, very close to the rectum, I am immobile. Violent spasming. So you could potentially have a food sensitivity test, and it's called ALCAT, ALCAT, and see if you have any food that you're intolerant to. Because Susan, I will tell you, oatmeal destroys me. You could try eliminating the dairy and eliminating the grains. I'll tell you the cereal that I can eat is an organic, like, brown rice cereal, but oatmeal absolutely destroys me. Susan says, "I'm English, same coloring as you. The Romans ate oatmeal." Yeah, but, you're not just Roman, you probably have other ancestors. Lisa says she's curious about the PEA on our website. That's a new one to me. Lisa, palmitoyl ethanolamide, also known as PEA, I was first introduced to it about 20 years ago by Dr. Lowell Parsons down in San Diego. He had a pharmacy in San Diego who was importing it for his patients who were struggling with pain. I met the pharmacist, I attended a lecture. Unfortunately, it was very, very expensive back then. And so it kind of fell off the radar. But palmitoyl ethanolamide has been studied for decades for all sorts of pain and all sorts of medical conditions in Europe. It's an over the counter supplement, very, very few, if any, side effects. Um, and in 2019, the Europeans, actually some Italians, did an ICPEA research study, which was phenomenal. They brought that study here to the United States, to the American Urology Association meeting, where it was what we call a poster. It was in the IC new research poster sessions. And here's what their research found. 87% of IC patients using PEA reported a significant reduction in their pain and symptoms by month 3. By month 6, many were completely pain-free. And so and the doctors who were there were very, very excited because they could finally recommend something for pain that was not an opiate, that was not associated with addiction or anything like that, that's affordable and over the counter, PEA. The general consensus among the researchers is that it's an endocannabinoid that acts by calming nerves down. It's what I take. I take Peora because I have very, very sensitive nerves. I have a healthy bladder. I don't need to do anything for my bladder wall, but I am very invested in keeping my nerves as calm as I can, and I do that with Peora, which I think, let's see. Here it is. Peora, PEA 500. And the cool thing is it's under $30. It's like literally one of it's I this is the future of supplementation. You're going to find PEA added to more and more supplements because the research is absolutely undeniable. There were no side effects reported in the IC research study. There are no side effects reported in the vast majority of studies on PEA. The safety profile is firmly established in dozens and dozens of research studies. Yeah, it's solid. She says, "Can you take it with other things?" Sure. Well, that's why, a lot of people ask me what's the best supplement on the market for, let's just say, estrogen atrophy or bladder wall driven symptoms. Bladder Builder combines chondroitin for the bladder wall, quercetin for the antihistamine, beneficial probiotics for the gut, and PEA to calm nerves down. So people want to know what the best supplement on the market is. I believe that it's this supplement. Um, yeah. So basically, the way Peora came around is I took that research study and I brought it to this company that makes Bladder Builder, and I said, "Hey, can you make us a PEA formula for here in the United States? Since we can't get that, we could not get the European formula." And they're the ones who created this for us. And this is absolutely the game changer in the IC world. For anybody struggling with pain and discomfort, this is the one that had the best success of anything out there. Again, 87% of IC patients using a PEA resveratrol combination reported a significant reduction in their pain and discomfort. And you can find this right now on the IC Network website in the IC Network store. Yes, that is Peora. Peora Poly 500 or PEA 500. Peora PEA 500. Sue says, when I'm in a lot of pain, I notice that I gulp air, which sometimes can cause me to be belchy or gassy. Maybe pay attention to how you're breathing. Um, I don't fart very much. I mean, we all do. I mean, that's the way the human body works. But I will tell you that almost every time I drink water out of a glass, I swallow air and I feel it in my stomach, which is why I use a straw because I don't do it as much. And that was something that my mom had done most of her life. I mean, it's always weird to realize that you're the result of two parents' unique health issues. Like I inherited my dad's blood pressure and heart issues. Um, I inherited my mom's sensitive skin and stuff. It's just so weird. And it's not a big heart issue, guy. I just throw PVC, that's all. But it's scary when it happens. Angie says I'm having a CT done in October, followed by a cystoscope to see what's going on with my bladder. Sure. I don't have a problem with you doing that. A CAT scan will at least give us a bird's eye view of what could be going on, especially if you have something like a fibroid tumor pushing on your bladder. Um, uh, and so that's reasonable. And CAT scans are very fast anyway. Carolyn says if it's hormonal, maybe that's why the antifungals aren't working. Um, again, Carolyn, girl, I had my yeast infection for 2 years. And if you ever read the insert that comes with diflucan, there's a little line that says some yeast infections will not respond to one or two diflucan, that you have to take the fungal for a longer period of time and a lot of it. And I did 450 milligrams of diflucan 7 days, 3 or 4 times. Um, I mean, so much diflucan that they had to monitor my liver enzyme levels to try to kill the fungus. But we did finally kill the fungus. Um, also, just so you know, I made a mistake during that whole thing because I thought diflucan killed everything. And the last time I went to the doctor for it, the pain was so severe, I thought I was having ovarian cysts. And so I went to urgent care and they did a sonogram, no ovarian cysts, dropped trowel, got up in the stirrups. He took one look and he gasped and he goes, Jill, I can see the yeast burrowed into your vulva. I can see it right here. It's burrowed into your vulva. And then he said, aren't you using the cream we give you with the diflucan? And I said, no. I thought the diflucan killed everything. And he said, no. On the skin on your vulva, not enough diflucan actually gets there to kill it. That's why we always give you the cream to use too. And they gave me a nystatin triamcinolone cream, and that's the one that finally killed that last population of yeast that had probably been on my vulva for 2 years. Also, make sure you're not sitting on anything hot. And Caroline said she needs to cut the sugar. She had a sensitivity test that voriconazole should work. Good. That's a new one. Donna says, I'm going on vacation, which includes a 10-hour car ride. Should I get a donut pillow? No, do not get a donut pillow. It's the worst type you could get. That's not the natural shape for the human body and for the pelvic floor. You want to get instead one of these. Rather than going for a circular pillow, you need a pillow with a groove down the middle. That way, each butt cheek is supported, but nothing is pushing up against your urethra. Hey guys, I need to take a bathroom break. Everybody, time to go to the bathroom. I'll see you back in a minute, okay? Hold on. Ah, my glutes are so tight. Stretch it out. Ugh, stretch it out. Like so you guys, I have no shame at all. I will talk about anything. I use my body as a teaching tool. So like right now I'm having rectal pain, but it's because of my muscles. Oh, yep. Oh, my muscles down there are so tight. Ugh, bat wings. That's my new swear word. I'm listening to a new book series, and the favorite character, whenever she gets angry, she goes, bat wings. I like that. Let's take a couple deep breaths. Let's just stop and check in a moment. Okay, deep breath in, deep breath out. Deep breath in, deep breath out. Okay, how do we get the brain out of fight or flight? It's really easy. The language of fight or flight is sensory information. You can't think yourself out of fight or flight. You have to prove to your brain you're safe. And the way we do that is by giving the brain good sensory information. It'll take 2 minutes. Let's just do it real quick and then we'll come right back to your questions, okay? So I want you to close your eyes and take a deep breath in and a deep breath out. Okay, now, if you could look at anything that would put an immediate smile on your face, what would that be? Would it be a child? Would it be a waterfall? Would it be the ocean? Would it be dogs playing? I want you to close your eyes and just think about something that you know you would be love to watch. So I'm going to visualize there's a big dog event going on right now at our local park. I was there yesterday. I might go over there again today. It's just so fun to watch happy dogs, right? So think about something that you would just love to look at for a couple of seconds. Okay? Deep breath in, deep breath out. Okay, what's your favorite smell? Coconut, rose, your lover, your pet, baking cinnamon rolls? What would you just love to smell that you know would put yourself in a very, very happy place? I'm going to go with baking cinnamon rolls. My favorite thing in the world. Nothing tastes better than a cinnamon roll during a pandemic, let me tell you. Okay? So close your eyes and think about your favorite smell. Is it coconut? Is it rose? Is it hot apple pie? Stew? Your mom's marinara sauce cooking? Deep breath in, deep breath out. What would you just love to listen to that would make you very, very happy? What's your favorite music? Or would it be a waterfall? Or would it be the ocean? I have been listening to a lot of Dua Lipa this week, and also Riverdance. I write really well to Riverdance. I can knock out good icy stuff listening to Riverdance. Close your eyes. Think about your favorite sound. Your favorite sound. Would it be the laughter of a child? Would it be the ocean? Would it be your favorite music? Jimmy Buffett, Kenny Loggins, because I'm old. Deep breath in, deep breath out. All right, now I don't care if it's IC friendly or not. Do not even mention it. What is your favorite thing to eat or drink that you know that first bite will be heaven in your mouth? What would you just love to eat right now? I don't care if it's IC friendly or not. What would put you in a happy place? Would it be that hot cinnamon roll? Would it be chocolate? Would it be pizza? What's your favorite thing to eat? Close your eyes, visualize it. I don't care. It's not going to bother your bladder. It's just, we're just visualizing it. So you go for your spaghetti. It's okay. Fudge, brownies, hot cinnamon roll for me every time. The first bite, magic. You're home when you have a hot cinnamon roll. Okay. Deep breath in, deep breath out. And lastly, what can you touch that would put an immediate smile on your face? Would it be a pet, a cat, a dog, a grandchild, your lover? I love it when people say, yes, how did you know? My lover. What would you just love to touch that would put an immediate smile on your face? I want you to close your eyes and I want you to visualize that. I'm petting my cat, Sammy. Deep breath in, deep breath out. And now, how do you feel? I feel better. I always feel better when I do that. You have to remember we are living in crazy anxiety producing times. This is not normal that we are living in the era of deadly pandemics. We are living in the era of firestorms, natural disasters, earthquakes, and crazy ass politics. Excuse my language, batwing politics. Um, this is not healthy for us. And we all have a PTSD. I certainly have PTSD. And my PTSD has actually been pretty significant the last couple of months. My anxiety levels definitely up, because I had to deal with the death of my parents too. But it's not, if you can't change the stressor, you have to change your reaction to the stressor. And what that means then is we have to have good anxiety management skills. Doing that deep breathing, doing that fight or flight. I mean, anything to calm this brain down. And we talk about this a lot on our website. I have a really good video, I see an anxiety on our website that talks about a class I took that completely changed my life. And it's about just building new skills. No shame. It's a crazy time. We're all anxious. And who's really anxious right now are doctors because they are, you know, I'll leave you with this. I have not seen I have had 3 primary care providers in the last 5 years. I've never met them in person. Never. They just want to do voice and video. And I just said enough. I want to meet you. I need to look you eye to eye. I want you to look at my body. I want you to help me understand why my back is hurting or help me understand why my blood pressure is going up and down, whatever. And they were saying, we don't have any appointments. We don't have any appointments. We don't have any appointments. And just like, I just pushed it and I finally had my first appointment to meet a doctor on October 17th, where I get to talk about stuff finally. And I asked her why. Come on, why aren't there any appointments? And she said, because Jill, you don't understand how many doctors are out with COVID at any given time. They're operating on a fraction of their workforce because COVID keeps circulating through everybody. So unusual times. Latcha says, I can't do coconut, allergic. What else is available? If you're talking about an oil, you could do a peanut oil. You could do just a really good high grade Evo oil. Avocado oil would work. Susan says, I don't really fart, it gets trapped, but I can tell in my lower colon. Well, so Susan, then you need to be working with a gastroenterologist, and they probably need to do a colonoscopy or give you a barium test May see if maybe you have something twisted or not. I will tell you for me, I'll tell you, this is where my gas lodge. So right side, all right? And so your large intestine starts right your lower right side. It comes up and it crosses basically underneath your belly button, and then it goes down into your left hip bone, like right there, right? And then it curves down to your rectum. My gas got caught here, upper right side, here, upper left side, and the worst was right down by my left hip bone. Lisa said, "Is a pillow also available for purchase?" You know what? I don't know if we got it in. Let me look. You can always go to the manufacturer, which is pelvicpainsolutions.com. Let me look at my shop. Here, I got to be on this computer. We have been waiting for it. They're made to order. Let me look. I have to log in on chair cushions. Whoops. Yes, I have some. I've got one left of the travel cushion. I've got 8 left of the U-shaped cushion. Either or would work. Yeah, so we've got a few in there. Get them while you can because they are hot. They are hot commodities. It would help if I put my glasses back on, wouldn't it? So what is the pain that radiates to your rectum? That's pelvic floor muscle pain. At least for me, it's pelvic floor muscle pain. Sometimes it's a hemorrhoid inside the rectum. Carolyn, where can you buy PEA? In the IC Network shop? Just go to our website, icnetwork.org, and click on store. Hold on a sec. Chris is asking, does it help with Hunner's lesions? That's such an important question. Remember cause and effect. Cause and effect. So we have 2 dominant theories about what causes Hunner's lesions. Number one, that it could be a virus, a viral infection. We have substantial research now that continues to find active viral infections in the urine of patients with Hunner's lesions, usually the polyoma virus or the Epstein-Barr virus. And we have our first research study that was presented this summer testing an antiviral. It was successful. It was a European study. And so, is there a supplement that could potentially help a Hunner's lesion? I would ask your doctor if they would be willing to do a blood test to see if you have any active viral infections. They can try an antiviral, and a supplement you could add is lysine, which is an amino acid which interferes with viral replication. And then the other thing would be PEA, because PEA calms nerves down. And our other theory of Hunner's lesions is that it's a very, very, very inflamed nerve. But we don't have any proof. Those are guessing. Those are my best guesses. We just don't have the Hunner's lesion population is a very small patient population. And to study a new treatment for Hunner's lesions, the patient has to be off all their other treatments. The problem is they're usually in so much pain that they're unwilling to go off of their other ones. Who could blame them? And so doing research with Hunner's lesion patients on treatments is very, very difficult. But there is substantial research with lysine reducing viral infections. There's no doubt about that. And I don't know if they have done a PEA study with lesions. They've done PEA studies with IC in general, and it's been quite good. Caroline says, maybe the PEA will be better than the amitriptyline. You won't know until you try. It might be. Amitriptyline tends to be pretty hard medication to take over time because it causes dry mouth, dry eyes, weight gain, and for me, it really messed my heart up badly. And I only took it for 3 months. So I gained 20 pounds and it gave me arrhythmias that I had for years afterwards. I took it in 1993, and I still occasionally get those arrhythmias that the amitriptyline started. Anne says, can a pelvic wand be used rectally for constipation? No. Sue says, does Bladder Builder have the same dose of PEA in it as PEA? No, it has less. Lori says, a Bladder Builder has PEA in it. Do we need to buy the PEA separately? No. Mary says, I'm not comfortable with the seat you showed. I have it and it's miserable to use. What is the next one? The waffle cushion. So Mary, what that tells me is if this cushion is painful for you, that tells me that you've got pelvic floor dysfunction, tight muscles in your butt cheeks. So this is not the cushion that I use when my muscles are flaring. This is the cushion I use if I'm having urethral pain, vulvar pain, or rectal pain, because I don't want anything pushing on it. But if I'm having pain in my butt, in my glute muscles, I use our waffle cushion, which is a flat beige cushion that has air in it and it has lots of holes in it. And it just puts like about an inch of air between your butt cheek and the surface of the chair. And so that waffle cushion is great. Donna, yes, you can find both of these in the IC Network shop. Denise said, I don't taste or smell 2 years since COVID, since this isn't helping, but visualizing my grandchildren makes me happy. Oh, that's good. Sue says, I wish I could have a glass of wine. Not right now, Sue, honey. Not right now. Your nerves are too sensitive. Chris says, can Hunner's lesions heal on their own? I'm doing the hyperbaric oxygen for 40 days, 5 times a week, praying this helps. I've had 4 surgeries to laser them. Chris, it might. Well, Hunner's lesions have been known to spontaneously disappear, but the fact that you're doing the hyperbaric oxygen therapy is really giving you a very good shot of healing those. But I would still ask for a viral test just out of curiosity to see if you have a viral infection. Shira says, is there a recommendation about coffee? What's going on with the delivery to Israel? Shira, the problem with Israel is we have way too much theft. 80% of the shipments we've shipped to Israel this year have been lost. And I can't afford to keep giving credits for that. I'll tell you exactly the straw that broke the camel's back for me with Israel was one of our customers from Israel who called, who got her package. It was flat. It was supplements. It was ripped open and it was flat. And she asked for a full refund. And she asked me to refund her customs. And I said, honey, I can't refund your customs. You have to go to your government to refund your customs. And the fact that you paid a customs fee proves that the product made it to Israel. The problem is that you have a mail theft issue associated with international packages. It was ripped open. Somebody stole the supplements. And again, the fact that she paid customs absolutely proved that it made it there. And I had to refund like almost $1,000 worth of orders to this theft. And I'm done. I can't do it. So I've been working with the leader of the Israeli group. I talked to her about it, and we're going to try to come up with a workaround, a third party company. But as a small business, I can't afford to pay for those losses. I've given everybody a refund, even though I did nothing wrong. And we prove the product makes it to Israel every single time. It's just being stolen. So if you have a friend here in California, I mean, here in the United States, a family member, have them order it. We can ship it to them. Then they can send it to you as a gift. When I send it to you, I have to fill out a customs form that puts the value on the right on the front. And that's probably why it's being stolen. People are reselling it. But if we ship it to a friend, they don't have to put the customs form on it. It's a gift and you'll get it. And I'm really, really sorry. With respect to the coffee, the best coffee you can drink is an herbal coffee called Dandy Blend. It's fabulous. It's in our shop. Love it, love it, love it. No caffeine, no acid, tastes really close to coffee. It's good. I had a cup last night before I went to bed. No flare. Um, or look in our shop for our low acid coffees. Bella Rosa is the best low acid coffee, but we've also got Tyler's coffee. And I'll be doing a blast email for Tyler's probably this fall. And so Tyler's has a lot of fans too, and they're the only ones who have their coffee in K cups. So just check the IC Network website, and those are our coffee recommendations. Kayleen, you never got the notification. It's probably in your junk folder. Hi, Kayleen. How are you doing, my dear? Um, Anne said, my physical therapist recommended using the pelvic wand rectally. You absolutely can use the pelvic wand rectally, just not for constipation. I was visualizing somebody sticking in a wand to try to move stool. That's not a good idea. If you have stool stuck in your rectum, do an enema or get a glove and use your finger. Your finger, a little bit of KY can pop any stool out easily. But yeah, men use the only way we can do physical therapy for men is rectally. And I will tell you, for me, when I'm having moments where my muscles are really tight by my rectum, I will use my finger inside my rectum, just slowly massaging the walls right in there. And it helps quite a bit. Mary says Dandy Blend has a high oxalate. I don't think so. I don't think Dandy Blend is high oxalate. It's chicory, and I don't know. Marlia says I burn after urination with wiping my urine comes flying out. More so at the end of the day at night, urination. Sometimes I pee on the floor before I can hit the toilet. Lots of cystos and scans. Everything looks great. Doctor said not a vein out of place. On occasion, I have a small red speck in the toilet. I started using estriol a week ago. Good. I have fibromyalgia and very sensitive skin. Okay, so we knew your central nervous system is involved. Do I see any benefits from drinking marshmallow root, corn silk, or slippery elm? Marshmallow root, you can certainly try. It helps about half of the people who try it. My bladder hates it when I drink a lot, but I know that I must. My back and muscles are in front get tight at day's end when I drink a lot, but I know I must keep drinking. So Marlia, really, you have three things that you have to do every day. You're my twin. You have to work on calming your nervous system down, and the Peora would be fascinating to try. You have to work on getting your muscles calm, and you probably have some estrogen atrophy. So I think you're doing everything right. You just have to be consistent and really stop expecting that a treatment is going to make a lot of this go away. And really hone your own skills with the techniques that you can do to calm those nerves down, that mind body medicine. Anything to calm the nerves down is critical here. Reducing that anxiety is critical. And again, nobody's saying mental illness. We're just saying central nervous system injury. Kayleen said, I ended up getting a UTI because I had one bowel movement that was really bloody. What? I kept cleaning myself because I had the bladder installation on Monday. I was in so much pain from the bladder spasms, everything from the clitoris to the vaginal opening. Sure enough, it's E. coli. Okay. I was really scared to start antibiotics because of my body. I was rejecting them. So far, so good. Excellent. You're drinking 80 to 100 ounces of water a day. Okay. I'm feeling better. Got a hernia binder on Thursday. Yeah, baby. Now I can actually sleep. Excellent. I'm only getting up 1 time a night to pee instead of 2 to 3 times. Okay, so things are doing good. I think it's interesting that you had a very bloody BM. I would wanna know what that was. Do you have a hemorrhoid? I mean, pretty much most of us have hemorrhoids, and so I know for me that, like, if I have diarrhea or I just have what I call my empty day, you know how you have a day where you just, like, poop all day? It's just like, one time, not done. Hour later, "Well, it's still more, not done." Hour later, "Oh, it's still more." That used to happen a lot. That doesn't happen so much to me anymore, but, I would have a hemorrhoid eventually, start to bleed a little bit on days like that. Mary said, "Is hyaluronic acid irritating to the vagina? I just used a moisturizer and it burns so bad." No, it shouldn't be burning. The odds are that your skin is very dry from estrogen atrophy, Mary. Chris says, "Do you know of anybody that had their bladder removed and had Indiana pouch?" Honey, we've got a support forum over on the IC Network website dedicated for patients with bladder removal. It was moderated by a woman who had her bladder removed 25 years ago. You can find a ton of really good discussions over at icnetwork.org in our forum, our support forum. And you guys, understand that the internet has changed. Before Facebook, the IC Network forum, and we got well over 50,000 patients have used it. Um, uh, mi- um, Hundreds of thousands of posts over there. It's this massive archive of IC information. But people don't use forums anymore. People go to Facebook and people do videos, which is why we're doing videos. So, and that forum costs a lot of money. I mean, it's like 5 or $6,000 a year. So, I might be getting close to the point where I might shut it down and delete it. I hate to do that because there's a massive amount of information over in the IC Network forum. I mean, it's the only place patients gathered for years until Facebook started, and it's a pain in the ass to maintain, I mean, to be quite honest. Mary says, "Why not use glycerin suppository?" Glycerin suppositories would be fine. A fleet suppository would be fine. A fleet enema would be fine. Whatever works. Kayleen says, "I have internal hemorrhoids, but they're not getting better. Everything to help it. So I can't do it because of the SA. I can't do because of, yeah." Well, the secret to bowel movements is fiber. You're having good bowel movements if it comes out as a long tube that kind of folds into an S shape in the toilet. That is considered a perfect bowel movement. I find that incredibly elusive. I would love to say that I'm like that. I might be like that once a week. Um, and so it's all about having enough fiber and having enough water. I had pizza for dinner last night with some corn for fiber. And I will say that this morning I did not have the normal poop I should have had. So tonight I'm going to make pumpkin soup because it's fall, and I'll probably put green peas in it. We'll see. Lisa says, "What do I think of Ticino coffee? It's herbal coffee made with dandelion." I just find Ticino very bitter. I personally didn't like it. The IC Network sold Ticino for years. We had a lot of complaints about its bitterness. I found that you had to put a lot of sugar in it, and and it just wasn't good to me. The Dandy blend, same ingredients with the addition of dandelion root, and dandelion root adds sweetness. And so the Dandy blend is not bitter at all. The Dandy blend is awesome. Kayleen said, "I have an OBGYN appointment tomorrow for a vaginal swab because everything is red. Then a urogyn appointment on Tuesday, kind of a pre-op, but also because I have a new bulge on top of where my bladder is." Good. I'm glad you're going, honey. I'm glad you're going. That hernia is a beast. Donna says she loves Dandy Blend. Lisa says, I got a cushion. I have to travel soon. I'm hoping it will help. I hope so, hon. Susan says, I'm not so good with the diet alterations. I guess if you suffer enough, you think he would do it. You know, listen, in my 20s, I was in so much severe bowel pain for so long. And again, this was bent over and screamers. I couldn't walk. I would have done anything to stop that pain. And so giving up oatmeal, giving up chocolate, ugh, fine. I let it go. I had no interest in living in pain. And the ironic thing is that like I love coffee, regular coffee. There's something about having a cup of coffee, a latte on my desk in the morning. I am so productive. But I can't drink coffee anymore because it triggers my heart really bad. And the last time I was at the ER with my heart, which was almost a year ago, the doctor was, Jill, you may never drink coffee again, ever. You're done. Your heart is too sensitive to it. And I don't want to be scared that I'm having a heart attack because my heart's beating out of control because it's a caffeine. So, at some point in time, we all hit that limit where we're just like, we're done. I don't need it anymore. I'm not interested in being in pain anymore. It's super easy to give up food. And I think now as we're getting older, we're all seeing that our health is dependent upon the quality of the food that we eat. And we're not kids we shouldn't be eating junk food every day. We shouldn't be drinking soda every day. It's not healthy. And having such sweet every day. So, like my perfect dinner is stir-fried vegetables with tofu. I don't use soy sauce because it's salty. Um, and I will do a veggie pizza, and then I freeze pieces of pizza, 2 pieces of pizza. So last night for dinner, I had 2.5 pieces of veggie pizza. I had a big bowl of corn. I had a gluten-free cupcake, a muffin. Actually, it was an apple muffin, and I had 2 mochis. I'm in love with mochis. 180 calories for 2. I can live with that because I really don't eat very much during the day. So, Kayleen said, "Oh, I have healthy types of stool, but there's blood every time. You would think after losing 60 pounds, my hemorrhoids would get better." Well, a hemorrhoid is basically a blood vein that's been pushed out of position. And sometimes they're pushed out so far that they'll never go back on their own. And they have to band them. What they do is they put a tight rubber band around the base of it to cut off the blood. So they might need to do that for you, hun. It sounds creepy, but it works. I was working with one guy, I got to tell you, years ago, one guy who had this big giant hemorrhoid, like the size of a walnut, that was popping out of his rectum every day. And he would have to push it back up into his rectum to stop the pain. And I'm like, dude, why haven't you had that treated? I mean, it had a long, attachment to it. They could just put a band around it and give it 10 days and it'll fall off and heal. He let fear stop him. We cannot let fear stop us. Carolyn said, yes, we need to start eating like an adult. Denise says, I love them too. Traders has apple caramel mochi. Yeah. I had an apple slush at the dog event yesterday that was insanely good. Oh my God. Carolyn said, so is it the acid or the caffeine that is bothersome to the bladder? Both. It's both, honey. The acid is corrosive to the bladder wall, and the caffeine is like taking a jackhammer to the nerves to give you frequency urgency. They're both a problem. Lisa here on YouTube says, "Do you think daily installations is too much, especially prone to UTI? I had one to learn how to do them myself, and lo and behold, I got a UTI." Lisa, number one, power to you for learning how to do it. Learning how to self cath is a fantastic skill to have because you will now never be in a position where you won't be able to empty your bladder. And so, power to you, girl. Um, Ultimately, we have to understand what we're trying to treat. So, will a daily installation help? I see subtype 2 bladder wall driven from estrogen atrophy. It'll help ease the symptoms, but you really need the estrogen to improve the skin. So, what you're doing with the daily installations is you're chasing the symptoms. You're not necessarily fixing anything. And I'm not against installations. If you're uncomfortable doing an installation is perfectly fine. But I want you to be laser focused on cause because we need to fix the underlying cause so that you don't have the symptoms in the first place. So if you have Hunner's lesions, you need to do Hunner's lesion specific therapy. If you have estrogen atrophy, then we want to heal the skin and coat the skin. So using that topical estrogen to help the skin and doing a bladder installation to give the skin estrogen, give the skin heparin to coat it, fine. If you have pelvic floor dysfunction, it's not going to fix the pelvic floor dysfunction. You need to buckle down and go to pelvic floor physical therapy. If you have widespread pain, central sensitization, then we need to do things that will calm the nerves down systemically. And the problem with the installation is you're only calming the nerves down in the bladder. We got to calm the nerves down everywhere. And so investing in good, like something like PEA, gabapentin as a traditional pharmaceutical, and of course, there's no substitute for basic mind body medicine techniques to bring that brain out of fight or flight. That's what we've got to do. We've got to get that brain out of fight or flight to calm that sensitivity down. And remember, nobody's saying this is all in your head. Nobody's saying this is mental illness. This is about calming the central nervous system down. And that's really what's changed. In years past, a lot of people were doing installations. Well, now we know why they didn't work so well for some people. Now we know why people kept flaring because we weren't getting to the underlying cause. Does that make sense? I hope that that makes sense, kind of, sort of. Susan says dandelion and the coffee blend. Yeah, dandelion root is the bomb. It is so good. Who knew? That kind of sounds like something that they would have recommended back in the 1920s. I am at the, when you're in severe grief, one of the things that can happen is hair loss. And I lost a lot of hair in August, like big bunches of hair in my shower every time I washed my hair. It was really quite scary. Thankfully I think I lost like a quarter of my hair. And they say that actually when your hair falls out, that's a good sign because what that means is that the new hair is now growing. So getting a really profound lesson on the tremendous toll of that grief takes. Wow. This has been mind blowing for me. Absolutely mind blowing. All right, guys. Any more questions? Any more questions? So, on the IC Network website in our free download area, you can download our pelvic floor relaxation exercises. If you're over on the website, make sure you sign up for our free newsletter. Also, I just put up we've done about 100 Meet the IC Expert events. Everything stopped with COVID. We just did our first one. It's with Dr. Martha Boone, the author of this book, The Unfettered Urologist. So I just put an hour-long interview with her up on YouTube, and I hope you'll watch it. I'm gonna try to do one of these a month. They're a lot of work, but I have several people in the queue now for our Meet the Expert series. Also, we in our newsletter that went out, we just sent out a very big newsletter last week. We announced another new clinical trial. So now we have two clinical trials. One of the clinical trials actually is fascinating, and Dr. Moldwin talked about it in the IC event yesterday. And it goes back to, okay. So this is one of the slides from the ICA event yesterday. And again, kudos to the ICA for doing this incredible event. You did a fantastic job. Well done. I'm going to when you have a link, I want all of my people to watch it. You deserve credit for this. This is one of the slides that Dr. Moldwin talked about. And these are our therapeutic targets. And this tells you kind of the diversity of treatments and how we really have to customize the treatment based upon your unique case. So, bladder wall structural defects, that's one thing we could treat. Bladder wall inflammation, systemic inflammation, nerve upregulation, widespread pain. That's what we're doing with the mind body medicine, is calming the nerves down. Central processing alterations, same kind of thing. Viscera convergence. This is critical. Bowel bladder, bowel bladder. So we knew years ago, it's called the pepperoni pizza algorithm. We had researchers who were trying to figure out why the bladder and the bowel are so connected. And what they found is when you irritated the bowel, the bladder also became irritated. When you irritated the bladder, the bowel also became irritated. Then what they did is they put radioactive tracers, one in the bladder, one in the bowel, and followed them. And guess what? They met in the same nerve in the spinal cord. So the bladder and the bowel are directly connected by nerves. So we have a new clinical trial for the first time and it's for pain relief, where they're putting a gel in the rectum and calming the nerves in the rectum with the hope that this will also pass through the nerves and calm the nerves in the bladder. And it's very interesting, very intriguing. We've got some supportive research of that. So I'll be sending out a direct email about this probably this week. It's already done. The company just has to sign off on it. So we've got some really good stuff in the pipeline to help us treat the totality of IC. Lisa said, I'm wanting to try my estrogen therapy again. I've tried it twice and I found bright red drops in the toilet. I immediately stopped, restarted it in a few months. Next time I saw just a drop. So once again, I stopped. Now I want to try it once more to be sure with the estrogen. Should I do this again? My estrogen was compounded too. My urethra screams razor blade pain, and I'm burning every single time I urinate day or night. I've been through pelvic floor therapy twice, and I do my breathing exercises. I'm going to buckle down and be more faithful with my exercises. Well, so Lisa, you're kind of shooting yourself in the foot, because it is an undeniable fact that estrogen loss makes skin weak and vulnerable to the point that it will easily tear. That's estrogen atrophy. I have worked with a few patients who, like you, have noticed that they've had some blood after using their estrogen. And my best guess, and it'd be very interesting to hear what your gynecologist thinks of this, is that your skin is just so thin that it's the equivalent of kind of a chemical injury. That said, You can watch under an electron microscope these very thin traumatized cells immediately absorb that estrogen and they get stronger over time. So, I guess the question that I have is location. Like if I were in your shoes. Now remember, I can't give you medical advice at all. It is never my job to give you medical advice. It is my job to open up some other ways of thinking about this and send you back to your doctor with maybe a new question. If I were in your shoes, I would be trying different locations. So, like, number one, using it on the outside on my vulva. I would do that for a week or two and see if that triggers any bleeding. Because estrogen on your vulva would not cause your bladder to bleed. I don't understand. I don't understand a mechanism of how that would make the bladder wall bleed. Then I would try it on your urethra. Because I had terrible urethral burning. I always felt like there was urine stuck in my urethra. And this, I was 52 when that happened. And I threw everything I knew at it, everything I knew at this new urethral pain, and nothing worked. And I threw myself on the mercy of my urologist. And he took one look and he knew what it was. And he goes, "Jill, didn't you use the estrogen cream I prescribed for you last year?" And I went, "No." I'm laying on my back. I'm in stirrups looking at him through my legs. He's looking at me with disgust. I really love that doctor. That he's like, "Jill, didn't you use the estrogen cream I prescribed for you last year?" I was like, "No." And he goes, "Why?" And I said, "Because in my brain, I'm 25 years old and I can't have an age related issue," which is true. And I'm 10 years older now and I still feel exactly that way. And he goes, "Jill, I saw this starting last year. That's why I prescribed it, honey. The urethra is the canary in the coal mine. It's the first part of the urinary tract that starts to scream when your estrogen levels drop." And he gave me the estrogen cream back, and he had me rub a pea-sized drop right into the entrance of my urethra. I went to my gynecologist the next day just to confirm. The gynecologist absolutely agreed. And it burned like heck the first couple of times I used it because I already knew I was very dry. But the burning went away after about 10 days to 2 weeks. I never bled. I never had bleeding though. Lisa says, "My skin is so thin and it looks like alligator. It's so creepy. I'm headed to Wake Forest to have a hydrodistension." So, Lisa, honey, you are in severe estrogen atrophy. You can see that right here. I have blurring powder on so that you can't see that. But that's the way my neck skin is. It's crepey. That's estrogen atrophy. So again, I would be very tempted to try it on your vulva first and then try it at your urethra. And don't be surprised if it burns. Your skin is obviously extremely dry. You have to power through that burning. And it's probably going to take about 2 weeks. I found that the burning reduced every time. So the first day I probably burned 3 hours. The next time I used it, probably burned for an hour. Third time I used it, might maybe burn for 10 minutes. Now when I put my estrogen cream on, it's like a puff of warm air. If I don't use my estrogen cream for a couple of weeks, the burn comes right back because my skin starts to get dry again. Kayleen said, "Even though I'm not part of her care, my physical therapist said one treatment is off for now. With being in a new relationship, I want to be active. This feels like deja vu." Well, honey, come on now. You've got a hernia. You've got lots of stuff going on. You got to give yourself a break, Kayleen. I know, outer course, girl, outer course right now. You are the perfect candidate for outer course. Go for that clitoral orgasm rather than that vaginal orgasm. Because right now you're too tender down there. But you might be okay. But again, you're going, "Jill, you forgot." I don't know how the clitoral orgasm would work for you. I mean, this is where I'm out of my element here. I don't know what you can do with your clitoris with sensitivity right now. I don't know. I'm very big on talking to your doctor about it and then not expecting your partner to figure out what's right or wrong, that we have to figure out what will work or not work. And the way we figure that out is with masturbating privately. We have to regain confidence in our body before we can try to have confidence with somebody else. You got to learn, figure out what feels good and what doesn't feel good. And um, patience, my dear, patience. You've come so far. You are halfway through solving the mystery of everything that's going on with you. Just be proud of what you've done. Remember what you've learned and take time and just let everything start to calm down. Shira says, I see hot white chocolate on the IC network has soy inside. Isn't it problematic? Not usually. Donna says, thank you, Jill, for all that you do. I really appreciate you. You're very welcome. But if you really like what I do, please come on over to the IC network and sign up to get our newsletter, or better yet, get our magazine. You can become a member of the IC network for $25 a year and read our magazine by email. We also have print magazines that are mailed, and you have member pages, and that's what pays for this. So if you can afford it, please think about becoming a member of the IC network or just buying something in our store or making a donation. If we didn't have that, I would not be doing what I'm doing now. We have bills to pay. Lisa says, do I use it daily? I don't. I do it 2 times a week. Depending upon how dry you are, sometimes doctors will have you do it every day for like 2 or 3 weeks just to saturate the tissue. And then you go back down to 2 or 3 times a week. That's where your doctor has to tell you what they want you to do. Yeah, the compounded estrogen, I get mine from the Women's International Pharmacy, women'sinternational.com. They're a fantastic mail order pharmacy based in Arizona. They ship around the country and it's inexpensive. It's also quite inexpensive. A local compounding pharmacist can do it too, but I found that the local pharmacists often charge 80, $100, $125 to make uh, compounded estrogen, whereas I get mine for like 60 bucks, somewhere in there, and it lasts for 3 months. Kayleen says we've done outer course and it almost did everything I wanted. Clitoris is fine. I just swells when I don't want it to. I'm staying away from everything when I have a UTI. Yeah. There you go. Good. Isn't it nice that you can come to a place and ask an embarrassing question and be taken seriously? Isn't it nice? The best part of my job is being able to talk to people in their 20s who are just where I was and be able to say the things I really needed somebody to say to me, which is, it's not your fault. You've done nothing wrong. No shame, no blame here. You're hurt. You're hurt. Now we got to figure out how you're hurt and where you're hurt to figure out the best way to treat how you're hurt. All right. Well, we've been going for almost 3 hours now. Give me your questions. Any other questions out there? Any other questions? Anything interesting happening this week? I'm very happy that I have like no dental appointments. I do not like going to the dentist at all. Paula says, You emailed me 2 weeks ago. I never answered. Well, let's see if I can find it. And I get a ton of email, and I'm not perfect. Hi, Linnea, if you're still watching. Um, Let me see if I can find it. Paula. Here it is. Have I ever heard of chiropractic care helping? Honey, I'm so sorry. I'm sorry that I could not answer it. Yeah, I mean, honestly, I still cry every day, just suddenly for no reason. I mean, I'm working a lot more now. I'm working full days now, but you know, it's I'm not all the way back. So let's see if I can answer you now. Have I ever heard of chiropractic care helping pudendal neuralgia? I'm just trying to think outside of the box. After 30 years of IT, I was very hopeful after my urologist implanted an inner stem over a year now. I haven't really had nerve pain relief. So you have burning, stabbing, pinching. So, Paula, that actually happened to me a couple of years ago. I felt like I was being poked by needles in my labia. Sometimes the left side, sometimes the right side, sometimes low, sometimes high. It was just bam, it's just like so weird. It was so weird. It started at the front, and over a week, it went all the way back to my rectum, but it was on my pubic hairline. It wasn't down in the meat of the labia at first. It was really around the outer labia. It was so weird. So I go to urgent care, and he looks at me. He goes, "Wow, you are bright red down here. You must have yeast." And he did a very aggressive swab, and he looked at it under a microscope and said, "Yeah, I think you have yeast." He put me on diflucan. Didn't work. I go, Okay, okay, so hold tight, girl, hold tight." Uh, I then went to my regular gynecologist. She goes, "It's eczema." She had me on steroids for 6 weeks, did nothing, got worse. So now I'm being poked randomly every other minute. Pin here, pin here, pin here, pin here. Like, holy hell, what the hell is this? This is awful. And she was young and she wasn't really listening to me. And so I just said, "Listen, I want a referral to the pelvic pain specialist in San Francisco." She's like, "I don't really," it's like, "I don't care what you want to do. It's my right. I want to talk to the pelvic pain specialist." And we did a phone meeting, and the pelvic pain specialist looked at my record and she goes, "Jill, don't you know what this is?" And I'm like, "No." And she goes, "Honey, your pelvic floor is tight again and it's squeezing your nerve. You got pudendal neuralgia." And I went, "But I didn't know it could cause this sensation along the labia." And she goes, "Yeah, we see it all the time." So what she gave me, Paula, well, number one, she sent me right back to physical therapy. And when the physical therapist was like, "Yep, you're really tight again." But she also gave me a lidocaine estrogen jelly to silence the nerves on my vulva. And that's something that Dr. Jerome Weiss talks about in my favorite book here, Breaking Through Chronic Pelvic Pain. That when you have a pudendal neuralgia, there are a couple of different things you have to accomplish. Got to figure out where the nerve is being compromised and try to release that with the pelvic floor physical therapy. And at the same time, we got to calm the nerves from the skin inward. And using that topical lidocaine consistently over time. And I will tell you, every now and then when I'm walking, I get a couple little pinprick. It feels like, that sensation you get if you pull a pubic hair, or if you get a pubic hair stuck in a zipper, like this kind of tugging, pulling sensation. Every now and then when I walk, I get that. Every now and then. And I have gotten that twice, like in the last week, only for like a minute or 30 seconds. But that's how I know my muscles are starting to get funky again. And that's when I will use this estrogen lidocaine jelly to silence that nerve, and most importantly, drop trow, get out my wand, and really work on my muscles. So, did the doctor you and I both love, did he ever talk about nerve blocks? I wonder if a nerve block, you do use a wand, it helps sometimes for a while. So, Paula, so here's the important question. And this is a question I want you to ask your physical therapist. And that is, are your muscles slowly relaxing over time, or are they always going back down into tension? Because mine always lock back down into tension, especially on my left side. Why? So for these patients who, no matter what the physical therapist does, the muscles always lock back down. That's when we have to take a step back from the muscles, and we have to look at what puts pressure on the muscles. Bones. So the reason why my left piriformis muscle always goes back down into tension is because my SI joint is not stable, and it's locking back down very tight to keep my joint in place. So it could be a bad hip, it could be a SI joint, it could be a tailbone out of position, could be a bad knee, and it could also relate to how you walk. And what doctor this became the mystery, the big thing that Dr. Weiss tried to solve in his last 15 years, and he did solve it, that the great majority of his patients who always locked back down into tension were not walking normally. I was not walking normally, and I had a physical therapist. He went, Jill, don't you, when you walk in arcs. You're favoring one side. You're not walking straight. You're doing this. You're always favoring one side. I had no idea I was favoring one side. And it all went back to my SI joint. So you're in Texas now so you're having treatment now for some rectal incontinence. Okay. Do we know why that's happening? And she says she's in a rural area and physical therapists are hard to find. Okay. So you're going to go to this website, pelvicrehab.com. The great database, the best database for physical therapists. You can find a database on our website at IC Network, but pelvicrehab.com, put your zip code in there. They'll show you the physical therapists who are properly trained. Okay, so you have loose muscles. So she's struggling with incontinence because she has weak muscles. Oh, Donna says she adds her lidocaine to her V Magic. What a great idea, Donna. Brilliant idea. I love it. Well, Hun, um, what's your zip code? Okay. Oh, I almost moved the IC network to Traverse City. I did. I fell in love with a guy who lived up in the northern part of of lower Michigan. I love Traverse City. Gosh, that was such a cool town. So I literally almost moved the entire IC network right where you are. He was in Onaway, Michigan. Um, and then it didn't work out. And we just lost him, actually. He just died last year. And he was 6 years younger than me. Okay, so hold on a sec. Let me just take a look here. I have a couple of different databases that I can look at. So hold on a sec. Oh, he got married. He married somebody else and had children. he had a good life, but he was in the military, and I'm sure he had cancer. I'm sure it had to have been cancer from a toxic exposure in the military. He was not the right person for me, and I was not the right person for him. So I see one physical therapist in Grayling. Are you close to Grayling? It's on 75, Highway 75. Are you at all close to Grayling? Do you know where Grayling is? So Grayling is by Hartwick Pines State Park. They don't do internal work? What? But she's hold on, that doesn't make any sense. Let me look at her. I mean, if she's taking the classes, normally they're in this database because she's at Mercy Hospital Grayling Rehab Services. Have you actually talked with her, or did they just tell you? I mean, have you visited that clinic at least once? You also had pelvic therapy in Gaylord? Hey, Grant. Grant says, I'm listening here from New Zealand. Can I have your email, please? I'm desperate for help with IC for 25 years, IBS, sensitive system. Like, yeah, here. My email is real easy. It's just icnetwork@mac.com. And I was just working a couple weeks ago with somebody in New Zealand. So we can Zoom. Okay, so you did an hour-long consult in Grayling. Did she do an internal assessment at all during that consult? Starting to get cold. Guys, we are here in Northern California, but we're having November weather now. The trees are turning bright orange. And we're starting. Uh, I haven't turned my furnace on yet. I'm getting real close. It's starting to get cold here. I mean, like 40 degrees outside. I'm going to get new windows for my home. You know what our power bill was? You know what my power bill was last January? My power bill, January and February? $950. It went to 400, 500, 600, 700. It jumped to 950 in January and February here in California for PG&E and Pacific Gas and Electric. And that was because my 100-year-old dad put the thermostat up at 73. And I had paid the power bill for 30 years. And I changed every light bulb, you name it, I did it to reduce it. And he finally just said, Jill, he was always cold. And after 30 years, I was like, Dad, you're too rich for me. He had a huge retirement. He could pay it. And if you want to turn it up to 73, power to you, but you're going to have to pay for it because you're too rich for my blood. You had an oat cookie last night. So miserable today. I can't believe it. Honey, oats destroy me. I have terrible reactions to oatmeal. Terrible bowel issues with oatmeal. We talked about that earlier. Um, so if you want to talk, I mean, guys, I would be happy to convert this over to Zoom for another half hour or so if anybody wants to talk one-on-one. Karen says, grief shares help me with grief, losing family. Honey, thank you. I didn't even know about that website. Let me look at it. Oh, this is fantastic. Let me see if there's a support group near me. I'm all about support, obviously. Oh my God, here's one really close. Hey, look at that. $20 includes workbook. Oh, it's a class. The next class, guilt and anger. I'm not angry. Hmm. Huh. That's cool. Oh, here's one that just starts. Oh, that's not. Oh, where is that? Oh, this is awesome. What a great resource. Thank you. Thank you. Thank you. Thank you. We'll see. I'm dreading going through holidays. You can go to one class or all of them. Oh, that's cool. Thank you, girl. Thank you very, very much. Lisa says, my physical therapist is very nice and has helped me some, but does very little hands-on. I'm wondering why I'm going. Well, it's the hands-on work that's the most effective. Paula says, do you want me to go to Zoom or call you? Well, let's go to Zoom. Lisa said, it's called uh, grief share for grieving. So let me do this. I'm going to go ahead and start up Zoom. I got about another half hour in me before my voice is probably going to say it's done. Let me start the meeting in Zoom. Got to put some makeup on. All right, participants, invite, copy invite link. All right. Thank you, Karen. This is the first close loss I've had. Everybody in my family lives almost till they're 100. My dad made it to 100. So, okay, so Facebook, there's your invite to Zoom. And let me give it to YouTube here. Hold on a sec. And so for the New Zealand guest, this would be a great time to start. All right, hold on. I just have to email the Zoom link from one computer to another. All right. Okay, that email's off. It will take a moment to arrive at this computer. There it is. Okay. Okay, so for those of you in YouTube, go there. But let me just say that just come in if you have questions because my voice is giving out and I can feel it's giving out. Okay. So if you want to come into Zoom, come on in. I've got one person coming in right now under the name iPad. Okay. Now just know Rel's coming in. For those of you who are in Zoom, don't say anything yet because everybody can hear you. Give me a quick moment. I'll be right back. Okay, so again, for those of you on YouTube, for those of you on Facebook, if anybody wants a little individualized coaching, you can come into Zoom right now. I'm happy to talk with you. And what I'm going to do is, let's see here. Is anybody having any issues? Paula, you can't find Zoom? Just click on the link, hon. Just click on the link. You don't have to find anything. Just click on it and it'll take you right there.
Okay. Okay. Am I in?
Jill, I'm here.
I know you are. Just hold tight. Let's just make sure that if there's anybody else.
Jill, I'm here from New Zealand. Can you hear me?
I can hear you. Excellent.
Fabulous.
New Zealand.
Okay, so and Lisa's coming in right now. Excellent. Okay. So what I'm going to do now is I'm going to shut down Facebook and YouTube, and we're transitioning this meeting over to Zoom. Okay. So last call for anybody on YouTube, any on Facebook. If you want to come on in and do a little bit of one-on-one, come on over to Zoom. Otherwise, I will see you next week. And remember, IC Awareness Month, we still have a few more days to go. If you can share our IC Awareness daily tips, that would be fantastic. If not you, who? It's up to us. It's up to all of us to spread the word. All right. I hate to, and Donna's coming in. I hate to turn it off when there are so many people watching. But I'm going to do it. Okay. So Facebook, you guys, I'll see you later. Be well. Okay, Facebook is shut down. YouTube, love you guys. I'll see you later. See you next week. Thanks for watching. All right.